Dr. Sanjay ji from Nagpur, that since you do good amount of work in sex education, how sex education and premarital counseling is related or any connection? Means what sex education you do in premarital counseling?
Actually, we say that sex education is not a situation or not a education like first standard, second standard, दुसऱ्या इयत्तामध्ये जो अभ्यासक्रम झाला तो संपला, आता तिसरी शिकवायची काही गरज नाही, असं काहीही नसतं. सेक्स एज्युकेशन इज अ कंटिन्यूअस प्रोसेस. Childhood, then adolescence, then early adults, and then even in geriatric age group also. So it's a lifetime sexuality. But sexuality is considered as from womb to tomb.
Correct.
So till the time a man or a woman is alive, there are chances that there can be a situation where sex education can be given. During premarital sexual relationship, what just yesterday only one patient came to me and he said that doctor, I am very nervous and not confident of having sex, so I went to a prostitute and then I failed in sexual intercourse. So my question, my answer to this question is, when these people they complete their education, they start earning, and they have a lot of questions in their minds regarding their own sexual competence.
Okay.
Unfortunately, what happens? The own sexual competence is tested by a person, either with his girlfriend or some known person or with a prostitute.
Okay.
And which is vicious cycle of failure, then performance, increased performance pressure and failure. So that is the right time that I think before marriage, they should definitely learn about how sex, what sex is, what romance is, what love, and do it or experiment it on others. The only thing is that when a man is experimenting, testing himself, that is a very highly pressurized situation.
Can take that liberty. As regards premarital counseling, Kamal's issue. Apart from what Sanjay has said, anything Jugani sir wants to say?
शादी, बंदा इसलिए शादी करता है कि वो सुकून से रहे. और जो शादी नहीं करते हैं वो भी इसीलिए नहीं करते. शादी वो अमल है जिसमें दो लोग मिलकर इस तरह रहते हैं कि एक दूसरे को रहने नहीं देते. वैसे शायर, हमारे जैसे शायर को शादी कर लेनी चाहिए. अगर बीवी अच्छी मिले तो जिंदगी अच्छी हो जाती है. अगर बीवी अच्छी ना मिले तो शायरी तो डेफिनेटली अच्छी लगती है. See, today I am very happy that this subject has come out on marriage and premarital counseling. This was not done before it. Only mothers used to tell their daughters, देखो ऐसा करना है, वैसा करना है, and all that. But today we have got a lot of evidence that when we counsel a couple before getting married as to how they should behave respectfully, accept, adapt, and tell them all the nuances of what can go wrong, what can be right in the relationships. These relationships, then they continue and maintain. What we are seeing today, in spite of all this counseling, couples get married, they have a long courtship period, 6 months, 8 months, 2 years, 3 years. But after 2 months of marriage, there's a divorce. They're going for divorce. Why is this so? And the girl says, no, he's not a marriageable material. What is material? I mean, they all have some preconceived notions which they have. They think themselves to be so educated that whatever they think is right, and this should be there in a man. Gone are those days when women today, girls today, we used to get our daughters married to a boy who had good financial background. खाते पीते घर का है, खुश रहेगी मेरी बेटी. That was the concept. But today women are empowered. They are earning more and equal to men. They are not bothered about the financial insecurities. So what else they want? That is what is lacking in men. Their expectations, and the men have a lot of fear, guilt, shame, whatever they have gone through in their life. So they don't come up to their expectations, and this is what happens. And these are the reasons where a counselor prior to marriage should help the couple understand these things.
Yeah. Okay, so very nicely said. My reflection over it is that many a times it is our human tendency to say immediately, look how he behaves. बघा तो कसं वागतोय, बघा तो सेक्स करतोय मॅरेजच्या आधी. We never ever think why he behaves so, and that why is very important. So initially what used to happen is that by the time 13, 14, 15, 16, good old days, marriage used to be done quite early. So the moment I become sexually active or my sexual awakening is there, the partner was officially available. Now what has happened, because of the evolution of the intelligence and because after 1960s, because of the postmodernism, individualism and liberalism and a total intelligence of the humanity which has increased, now what has happened, that in the new generations, especially after 1990 and 2000, the boys and the girls, they, of course, and we are only telling them to get educated. So either I want to become a doctor or an engineer, or my MSc, my MPhil, my PhD. Thereafter, I will earn something. Then I have to, from the age of 9, MC starts 229 आमच्या sexual energyचं करायचं काय. So the algorithmic approach is, number one, please do not have destructive use of sexual energy before marriage and even after marriage. That is rape, sexual harassment. असं करू नका. Second, as far as possible, please, as they have rightly said, please do not do any kind of experimentation. Third, पण कधी-कधी निसर्गी पायवाट असते आणि पाय सटकतो. समजा पाय सटकला तर at least use condom and have a protective sex. And the best part, see, idealism and practicalism is totally different. Okay, and the best part is that have a non-penetrative sex. Agdi hawach asil tar. And nowadays, remember friends, that there are two. Initially, what used to be there? Initially, it used to be there something called as a prescriptive approach. Welcome, sir. Venkatji, aye, बैठिए.
Welcome Dr. Venkatramana sir, who is the chairman of Council of Sex Education and Parenthood International India. He is traveled from Hyderabad. Welcome sir.
Thank you. Is he visible to you? Or else we can take the restroom down. So, Venkatji, we have started with the discussion. We have finished with the question that as regards marriage and premarital, marital, extramarital, and we are talking as regards premarital. So, I will be eventually coming to you. And the thing is that initially people used to like something we used to do, even the parenting, the teachers and everywhere, and even the bosses, prescriptive approach. ये बताया ना, ये तू कर. आजकल के ये जो नए लोग हैं वो नहीं मानेंगे. They need something called as a descriptive approach. So we have to tell them premaritally that if you have a premarital sex, then these are the consequences. If you do not have, then these are the consequences, and something called as a cafeteria approach. Now you choose. The entire life actually is a series of choices and decisions, and every choice and decisions has an advantage and disadvantage, and that is what we are supposed to tell them. And of course, in a counseling, vivek buddhi jagrut karaychi, and that is what premarital counseling should be done. Okay, so now moving to another. Now we will directly move to the marriage only. So, Venkatji, can you tell us that being a dermatologist also, that which is the most important sexual organ, and as a dermatologist, how skin is related to it?
Yes, very pertinent question. Which is the highest sex organ, I mean to say. As a dermatologist, for me, skin is the largest sex organ. By saying so, I am justified that skin contains innumerable number of nerve endings. And the beauty of the skin that first titillates or ignites the desire of the sex. And it contains thousands of capillaries, veins, arteries that will increase the blood supply to the skin. That cajoling and kissing gives the warmth that again initiates the sexual activity. So for me, skin is the largest organ. For psychiatrist, psychologist, brain is the largest organ. For a venereologist and pure sexologist, penis and vagina is the largest organ. For sociologist, partner, beautiful partner is the largest important area. For in a holistic way, integration between all these things will give a nice, beautiful sex organ. Mind to the penis, to the skin, and to the partner. This connection is needed. Thank you.
बहुत ही holistic जवाब दिया सर आपने.
Thank you.
Yes. Can we take this down? Just a small. We will take a break. I will move this over here so that all of them will be visible. I'm sorry, I don't need computer. Yeah, okay. So is this better now so that the panelists they are visible? So I will slightly like this. Okay. So then the next question is that Jumani sir is a physician basically, MD medicine, and I would like to ask him that how does the blood biochemistry and body or the endothelium would be affecting sex in marriage?
We are all born out of love and sex. Love is a matter of chemistry. So a lot of chemicals are involved. Neurotransmitters, hormones. And sex is a matter of physics. Physics handles the blood flow in the pelvic organs. In men, the commonest issues which we see is erectile dysfunction, low desire, early ejaculation. In women, commonly we see is low sexual desire and of course painful sex and depression and other things. The main cause which men suffer are metabolic syndromes, be it diabetes, hypertension, raised lipids, smokers, alcoholics, stress, certain drugs, injuries to the spine, brain infections. And the common pathology, what we see is the endothelium, which gets dysfunctional. Endothelium is the innermost lining of our vascular system and lymphatic systems everywhere. It is this lining which needs to be corrected, which does not get corrected by giving PD5 inhibitors, Viagra, or by implants or by vacuum therapy or intracaverous. So we need to be scientifically correct by treating these patients, by counseling them for lifestyle measures and try and restore their endothelium. Not just give them symptomatic treatment of giving PD5 inhibitors. So this is one important take-home message. PD5 inhibitors do work, they are fantastic, but they are not curative. And 40 to 50% of our patients do not respond to them. So something we have to do to restore the endothelium, which can give them a better sex life, not unrealistic sex life, which they get by taking multiple PD5 inhibitors, etc. Second thing, in women are tight-lipped. To talk about it is just like a sin to them. नहीं जो अभी हो गया ना, बच्चे हो गए, अभी क्या है? Even after 30-35, they feel sex is not important for them. And this inhibition also inhibits their husbands to become intimate to them. Her loss of interest, her more interest in children, her not taking care of her own physique, how she looks, how she wears, how she works at home. So all those things need to be corrected. And mainly in women, what I have felt and seen, all women who have these diabetes, thyroid, all issues, they all have depression. And many of them go to psychiatrists and they get antidepressants, which worsens the whole thing. The depression is not because of something which happened, it's because of the unmet desires which they have. So those unmet desires have to be addressed properly by them. So these are the two things which we should take care of when we ask this please or when we try and treat them in many of the patients who have endothelial dysfunction related to sexual disorders.
Yeah. So endothelium is the most important thing, and what I would like to say is that many a times that means people are having blood pressure, diabetes, cholesterol, all these disorders. At the root level, many a times sexual problem can be the reason. All these reasons because of stress, but stress because of what? Maybe the husband or wife, they are not satisfied with their partners in the bed or in the marriage. Because marital life influences bed life and bed life influences marital life. So they are the two sides of the same coin, and hence I would request the audience that please ask a direct question comfortably. We never ask as regards sexual histories. Bowel, bladder, appetite, sleep, what about sex? So, is there any problem with sexual life? And this I happen to take a chance to tell in almost in every talk, that always use the word enjoy. Do you enjoy sex with your partner? How much drinks you enjoy? How do you enjoy tobacco? Because when you, as a doctor, in history taking, I am saying, the moment we use the word enjoy, a signal message goes to the patient that, oh, the doctor is very open to all kinds of communication, and there is no sort of evaluatory nazaron se wo nahi dekha, and many a times it will happen that you will hit that point. Okay. So before I proceed to the photography team, I would request that whenever the panelists are talking, you please zoom in and त्यांच्या चेहऱ्यावर फोकस द्या पूर्णपणे. ओके, नाही तर कधी काय आपण नुसतं लॉंग शॉट देतो आणि मग जेव्हा बोलतोय ते फिरवा. मी फिल्म इंडस्ट्री आणि नाटकाशी रिलेटेड म्हणून मला याचं भान आहे. ओके, ऑलवेज जो स्पीकर बोलतो त्याला फुल कम्प्लीट त्याला स्क्रीनवरती या आणि मागे पुढे करा, तर ते ऑनलाईनच्या लोकांनाही पोहोचेल. Okay, so now the next question, yeah.
One simple sentence in every patient about 30 years having a family history of metabolic syndrome.
Yes.
Please ask them one small, very sweet question. Do you have problems in making love?
Kya?
You will be surprised that your patients were waiting for you to initiate a dialogue on this.
Yes.
And then tell them that in patients who are diabetic, having high blood pressure, having lipid disorders, smokers, they do have issues in the bedroom which can affect their sex life, their relationships, and there is a cure for all these things today. Believe me, he may not tell you at that point of time, but he will remember and register this in his mind, and next meeting he will come and ask you, डॉक्टर तुमने वो बोला था लास्ट टाइम, मुझे लगता है थोड़ा प्रॉब्लम है. Do this. This is very important. It's not a vulgar thing. See, patients, if they don't ask and doctors don't ask, where will this, how will this taboo end? Who will be responsible? We are responsible. The onus is on us. We have to break the ice, remove our clinical inertia, and ask our patients. Every physician should make it a point to ask every male or a female above 30 years having a history of metabolic disorders. Because sooner or later, so father को diabetes है, इसको होगा ही, इसको diabetes है तो ED होना ही है. And this will help by, because as early as you detect these issues, say erectile dysfunction, at the onset, we have now enough evidence to prove that erectile dysfunction is the earliest marker of myocardial ischemia. Sooner or later, after 3 to 5 years, this chap will develop either angina or an infarct or a stroke. So you're asking him and then suggesting him lifestyle modification, counseling, etc. will retard the onset of critical events in his life, and that's your duty. That's what you are here for. This is a simple, small take-home message which all should take.
Okay. So basically, EDS can be a marker of angina, and as everybody knows, the penile artery is 6 times smaller, the lumen, than the coronary artery. Correct? Yes. So now the question from that will move to Dr. Vijay Dadpade, sir. As an andrologist and urologist, how do male sexual dysfunctions that would be of a husband affecting the marriage?
Good evening, all of you. You might be watching me very regularly on TV and media. When in my OPD, always it's a big number of OPD we are observing. What one sir was telling, history taking is the first key point. Even I am a surgeon. One cannot isolate that as I am an andrologist, I am just concerned, as I am a surgeon, just concerned with surgery. That part comes at the end. Combination therapy. How infertility and sexual dysfunction is related. Now, whenever you marry, whenever marriage is done, after 1 year, everyone start asking, Prasanna, everyone start asking whether you want a child. And neighbors are much more worried about your family. That is the most big point.
Good news. Yeah.
And again for a marriage also. म्हणजे शेजारच्याला जास्त काळजी असते की तुम्हाला मूल का नाही झालं. आणि यामध्ये लग्न हे मूल होण्यासाठीच करायला पाहिजे असं अजिबात.
Correct. So it is not just for creation or procreation, but also for recreation. Yes.
And second important thing, how it leads to sexual dysfunction. Every morning, once 6 months, 2 times history are taken. Every morning, mother, father, in-laws and all, if that daughter-in-law comes right, that's why means that male fellow is so get fed up. One thing is that you are all given condition different. फार छोटी घरं असतात. खुडखुडा आवाज जरी बाहेर आला की डिस्फंक्शन होतं. आपण अशा वेळेला आम्ही सांगतो की थोडं फिरायला जाऊया, ऍटलीस्ट एखादा महिना 15 दिवस तरी फिरायला जाऊया. And when you make a compulsion to your son or that your daughter, you must conceive, the moment you start telling that, he again starts dysfunction. Compulsive disorder. Like this way, whenever that person, everyone wants to kill. If suppose by any 3 to 4 years are over, did all the investigation, did semen analysis, they say it's normal, female investigation, all things are normal. सगळं काही नॉर्मल आहे पण मूल होत नाही. इट पॉसिबल. So this is always a statement which comes. I always tell that all gynecologists might be here. This hormonal value, FSH and AMH is like this value. Anybody has think on that lowest level and highest level. In between which lowest is abnormal and which highest is abnormal? Is there any meridian? So this hormonal thing, LH is related to orgasm. And if that lady is not getting orgasm, then it's so nicely related to that orgasm. That is the big point of ovulation. And at that moment, when you get, then only you can get a child. And remember, after 2 to 3 years, if they both are fed up, sometimes they give up for the treatment. They are not going to doctor. Even everybody is fed up. So why do they say then? This negativity side. फायदाच काय? फायदा झाले की आपण करतच नाही की मला फायदाच होत नाही. इन कशाला सेक्स होतो? Day by day, such type of separation, then conflicts, and even they end up with extramarital affairs. And why this is important? Why parents? Why our community? Why our surrounding is important? Unless and until you clear your ideas. one simple question.
Excuse me, sir. We are having very less time.
Okay.
So if you can.
Second round we will discuss again.
Yeah. So now the question goes to.
फक्त एकच मला मी नेहमी असे इन्फर्टिलिटीचे पेशंट आमच्याकडे ज्यावेळेस येतात, दे आर मोस्टली रेफर्ड बाय गायनेकोलॉजिस्ट. त्यांना मी 2 लाईन सांगतो, कारण त्यांना बऱ्याच वेळा सायकोलॉजी अबाउट इन्फर्टिलिटी अँड अबाउट सेक्शुअलिटी दोन्ही होतात. त्यात फक्त 2 लाईन सांगतो. व्हेन लव्ह मेकिंग बिकम्स बेबी मेकिंग, प्लेजर बिकम्स वर्क.
Pleasure becomes
वर्क.
work. Okay. Yes.
पण मग काम कोणालाच आवडत नसते हो.
Good. क्या बात है. बहुत ही बढ़िया. Yes. Now coming to Dr. निवांत. सगळं निवांतच आहे त्यांच्या याच्यामध्ये नावामध्ये. सो हा मनाचा निवांतपणा कसा इन्फ्लुएन्स करेल सेक्सला अँड इवन द सायकॅट्रिक अँड पर्सनॅलिटी डिसऑर्डर्स इन द मॅरेज. If a husband or wife is having some psychiatric or psychological problem, so can you give the reflection?
Personality disorders पेक्षा मी काय म्हणेल, मॅरेज हे कन्सेप्ट तुम्ही आपल्या पारंपरिक केसेस माझ्यामध्ये बघायला गेला तर त्याची प्रोसेस हे.
सर थोडा माईक जवळ देणार.
ते प्रोसेस हे आपल्या समाजामध्ये पत्रिका बनणे पहिली गोष्ट. त्यावेळेस काय करतात, परत पर्सनॅलिटी काय अशी उंजून लागतात किंवा इथून सुरू होते. किंवा दुसरी गोष्ट माइंड हे असं आहे की एखादी व्यक्ती आवडते, जसं लव्ह ॲट फर्स्ट साईट आहे, तर हे प्रोसेस ही माइंडची इथून सुरू झालेली असते त्याच्यामध्ये. तर पर्सनॅलिटी सायंटिफिक बघायला गेलं तर पर्सनॅलिटी जे क्लस्टर्स असतात, क्लस्टर A, B, C याच्यावर आहेत. आणि याच्यामध्ये क्लस्टर C जे असतात, अँक्सियस, थोडेसे ऑब्सेसिव्ह किंवा आणि क्लस्टर A मध्ये हिस्ट्रॉनिक वगैरे असतात, दिखावा करणारे. किंवा काही क्लस्टर B मध्ये मॅनिप्युलेटिव्ह आणि हायपरथायरॉइड असतात किंवा हायपोमॅनिक पर्सनॅलिटी असतात. ते कसा रोल करतात, याचं पर्सनॅलिटी हे सायकॅट्रिक डिसऑर्डर डेव्हलप होण्यामध्ये खूप मेजर रोल करतात. याच्यामध्ये कसं आहे, क्लस्टर सीचे लोक मोस्ट ससेप्टेबल डिप्रेशन वगैरे असू शकतात. क्लस्टर एचे जे आहे ते सायकोसिसला आणि क्लस्टर बीचे आहे ते डिसऑर्डरला, असं बऱ्यापैकी. दुसरी गोष्ट सायकॅट्रिक मॅरेज. काही लोकांना प्री मॅरेजच्या अगोदर सायकॅट्रिक डिसऑर्डर असतात आणि त्यांचं मॅरेज, किंवा काही लोकांना पोस्ट मॅरेज डिसऑर्डर होतात. एक सेक्शुअल लाईफ कसा अफेक्ट होतात, तर उदाहरणार्थ वेगवेगळ्या डिसऑर्डरमध्ये जसं डिप्रेशन आहे, तर डिप्रेशनमध्ये लिबिडो खूपच कमी झालेला असतो आणि त्याच्यामुळे सेक्शुअल डिस्फंक्शन आणि ते विशेष सायकल होतं. त्याच्यानंतर त्याच्यावरून अँझायटीमध्ये सेम तसं बऱ्यापैकी परफॉर्मन्स अँझायटी असते, सेक्शुअल ॲक्ट होतात. त्याच्यावर तुम्ही बघायला जर पेशंट किंवा डिसऑर्डर एखादा मेन पर्सनली ट्राईज त्याचं हायपोमेनिक असतं किंवा हायपरथायमिक असतं, किंवा तो पेशंट हायपोमेनियाचा असेल तर त्याची जी आर्ज आहे किंवा सेक्शुअल डिझायर खूप वाढलेला असतात. प्रचंड वाढल्यामुळं रिपीटेडली बऱ्याच प्रॉमिस किंवा काही वेळेस फिमेल्समध्ये पण कंडिशन एक्सपोर्टेड आहे की निम्फोमेनिया. निम्फोमेनिकमध्ये काय इंटेन्स सेक्शुअल आर्ज असतं, याच्यातून बऱ्याच
Okay, so the moral of the story is that mind will be affecting the sex and vice versa, and basically our lack of sexual assertivity. Okay, so sexual aggression, sexual passivity and sexual submissiveness should be basically converted to a healthy sexual assertive personality. From that I would like to ask to Sanjay Deshpande sir, can you tell us something as regards consent in marriage and rape in marriage?
व्हेरी गुड क्वेश्चन. आणि आता सध्या फार मोठा चर्चेला जाणारा असा हा प्रश्न आहे की इज इंडिया, आपल्या ऑल ओव्हर वर्ल्ड जवळपास 150 कंट्रीजनी मॅरिटल रेप इज क्रिमिनलाइज्ड, पण भारतात झालेलं नाही. म्हणजे दुर्दैवाने नवऱ्याने बायकोला जर मारलं तर डोमेस्टिक व्हायलन्सच्या अंडर त्याला सजा होऊ शकते. पण बायकोच्या मर्जीच्या विरुद्ध सेक्स केला तर त्याला सजा नाही, म्हणून त्याच्यावर बराच लिगल इश्यू सुरू आहे. तर मी माझे काही 2-3 ते मुद्दे मांडले होते. त्यात मला आता मी मध्ये एक मराठी नाटक केलं, मोरूची मावशी.
ओके.
ती नकली मोरूची मावशी जी असते ना, की त्यावेळेस रावबहादूर टोणगे त्याचं काम मी केलं होतं. त्यांना म्हणते माझ्याशी लग्न झालं तर प्रत्येक काम करायला तुम्हाला एक अर्ज द्यावा लागेल. तसं होणार आहे की बायकोचं चुंबन घ्यायचं तरी अर्ज द्यायचं, कन्सेंट घ्यायचं, खिशात ठेवायचं, चुंबन.
सो मिसयूज. येस.
सो हाऊ टू टेक कन्सेंट. बरं, दुसरा अजून एक मुद्दा असा होता की कन्सेंट, डिझायर अँड रेडीनेस इन सेक्स, या 3 वेगवेगळ्या गोष्टी. डिझायर असते, रेडीनेस टू इन्व्हॉल्व इन सेक्स पण असतो, पण कन्सेंट देता नाही, कारण दुसऱ्याचा नवरा असतो किंवा दुसऱ्याची बायको असते, असं सुद्धा होऊ शकतं. आणि कन्सेंट म्हणजे खूप त्याच्यात, म्हणजे आपण जर त्याचा विचार केला तर त्या उहापोह करता करता आपल्याला 15-20 मिनिट अर्धाच लागतो. त्यामुळे कन्सेंट इज अ व्हेरी डिफिकल्ट टर्म टू डिफाईन इन मॅरेज. आउटसाइड मॅरेज ठीक आहे, पण मॅरेज साठी मग काय कन्सेंट आपण वर्षभराची एकदा घेऊन ठेवणार की रोजची कन्सेंट घेणार, आणि दॅट विल बी व्हेरी डिफिकल्ट टू प्रूव्ह इन द कोर्ट ऑफ लॉज. कारण आधी दिलेली आहे, नंतर दिली. बरं, कन्सेंट देण्याचे वेगवेगळे कारण पण असतात की बायकोसाठी जर समजा एखादा सुंदर दागिना घेऊन आला तर ताबडतोब कन्सेंट मिळेल. पण किती काही म्हणतो की सेक्स इज अ पॉलिटिक्स ऑल्सो, पॉलिटिक्स इन सेक्स.
येस.
की तुम्ही माझ्या आईवडिलांना काही सांगितलं होतं ते केलं नाही, किंवा तुम्ही लग्नाआधी सांगितलं होतं ते केलं नाही, हा सुद्धा एक कन्सेंटचा भाग होता. आणि नंतर आम्ही बीइंग सेक्सॉलॉजिस्ट वी आर मोर कन्सर्न अबाउट मॅरेज. मग मी एक प्रश्न विचारला त्यांना, मग तुला चर्चा झाली त्यावेळेस, की एखाद्या माणसाचा सेक्स मध्ये इंटरेस्ट नाही, तो सेक्स करत नाही, म्हणून मग ती बायको त्याला 4 चौकात सांगते किंवा कोर्टात केस करते की माझा नवरा इम्पॉर्टंट आहे, नामर्दा आहे. खेड्यापाड्यांमध्ये खूप आहे, आणि हिंदी भाषिकांमध्ये तर पहिल्या रात्री जर सेक्स जमला नाही ती म्हणते घरी जाते, कारण त्याच्याकडे कसं आहे, लग्न झालं 2 दिवसानंतर ती पोरगी घरी जाते. आपल्याला साधं नाही की वर्षभर ती सोबतच राहते. त्यामुळे आपल्याकडे सेक्शुअल प्रॉब्लेममुळे डायव्होर्स होणं जरा कदाचित कमी असावं असा माझा अंदाज आहे. ते 2 दिवसानंतर घरी गेल्यानंतर म्हाताऱ्या कुतारा विचारतात की आपला सेक्स झाला का, ती म्हणते नाही. येतो लडका नाव. आणि मग त्याच्यावर 420 खटल्यापासून तर डायव्होर्स पर्यंतच्या सगळ्या अलिगेशन होतात. मग त्या नवऱ्याने जर म्हटलं की मला इच्छा नाही म्हणून मी केला नाही, कन्सेंट ऑफ अ मॅन, इज इट नॉट पॉसिबल और इज इट नॉट इम्पॉर्टंट? म्हणून त्याला स्पाउसल सेक्शुअल व्हायलन्स म्हणा, म्हणून आम्ही एक त्यांना हे दिलेलं आहे की स्पाउसल सेक्शुअल व्हायलन्स कॅन बी ऑन एनी स्पाउस, मॅन एज वेल एज. त्यामुळे कन्सेंट हा खूप मोठा, जसं आपण मेडिकल कन्सेंटच्या बाबतीत आपण इतकी त्याची उहापोह करतोय, तर 2 व्यक्ती जन्मभर सोबत राहणारा कदाचित एखाद्यास कन्सेंट नसेल, पण एखाद्या बायकोने जर मराठा प्रेमचा आहे, ह्या नवऱ्याने त्रास दिला तर तो काय करतो. त्यामुळे त्यांना मी दुसरा असा मुद्दा दिला की रिपीटेड व्हायलेशन जर झालं तर त्याला आपण गुन्हा ठरवावं, पण इफ इट इज वन्स और ट्वाइस इट शुड नॉट बी अ व्हायलन्स, सेक्शुअल व्हायलन्स. आणि इफ इट इज विथ डोमेस्टिक व्हायलन्स, फिजिकल व्हायलन्स, then should be punished. That was my suggestion.
Correct. So that means what in the movie of Pink, Amitabh Bachchan has said, no means no even in the marriage. And second thing is that many a times 2 things. This is a very good actually what I would say school of thought, that whether a sex is done as an end in itself or whether sex is a medium for some another end. म्हणजे मला काहीतरी वेगळंच पाहिजे, जसं सरांनी सांगितलं मला दागिने हवे, 9 लाखाचा हार चाहिए इसलिए मैं सेक्स करती हूँ, तो ये दोनों चीजें अलग रहती है. वेल कमिंग टू यू,
बरेच वेळा पुरुषांना नोला यस कन्वर्ट कसं करायचं हे शिकवायला. मेनी टाइम्स नो इज नॉट नो, यू हैव टू कन्वर्ट इट टू यस.
And from NO no for both husband and wife it should be converted to KNOW no. So that will be the knowledge of sex.
One simple suggestion.
Sir, एक minute. Venkat ji, just विचारते because thereafter I will be coming. That basically as a dermatologist we have seen that genital vitiligo is there where they don't tell this before the marriage, and just to hide that the husband or the wife would be insisting of doing the sex only in the darkness. And then in darkness, nudity, touch and sex cannot be really enjoyed. That doesn't mean halogen मध्ये sex करायचं आहे, halogenच्या light मध्ये. So, sir, how would we should go about it? As regards counseling, whether they should tell, they should not tell, whether genital vitiligo is there or not. Because that is a pertinent question.
Absolutely. For Indian continent, till 11th century, our society is an open society. Sex was explicitly discussed between the girls and boys, between the woman and men, between the wife and husband. The testimony for that is, in those days, woman used to choose the husband, not the husband going and choosing the own wife. Swayamvar. That was the dictum of social dictum in those days. The scenery had totally changed from 11th century onwards. Now today, I know I will be discussing that in my talk. Today, we are in the conservative area, where whether to tell or not to tell, what happens if I tell, what happens if I won't tell. Most of the times our grandmas or great-grand people will be asking us, no, that is a very good alliance, don't tell this, a small thing, hiding, so this is not from the girl side, even boy side also. Boy also do get vitiligo of abuse. This will also won't reveal. To hide this, yes, anyhow, with this or without that, with normal, without normal, nowadays our inculcated into the mind from the 11th century onwards that sex should happen in the darkness. So because of that, these things will happen. A day will come where when she feels sick, she get infection, I'll go to doctor. Doctor will tell, doctor क्या हो गया मेरे बेबी को? कहते डॉक्टर क्या हो गया मेरे बच्चे को? नहीं कुछ नहीं, एक सफेद धब्बा है, थोड़ा इन्फेक्शन है. सफेद धब्बा कैसा है? कब से ऐसा डॉक्टर? ये बहुत दिन से है सर. चलो. So this is the way the interaction goes on. For that sake, if they come to the doctor, that's why he has taken up a very good issue, premarital counseling. In this premarital counseling, this type of issues will crop up. So what are all the things that are already there in their bodies? Are they interfere with the sexual intercourse or not? Vitiligo, absolutely won't interfere with sexual intercourse. It's only a cosmetic problem. There are many remedies for it. Even before marriage also, if they want, we can make it normal skin. Many remedies. So through counseling, this type of discrepancies in future life can be avoided by doing premarital counseling. Not only this, many more conditions are there. Dermatological conditions, which are harmless in nature, doesn't look nice to see, but because of our psyche, they will interfere with the interpersonal problems.
So we are moving, because of the time restriction, we are moving to the fag end of the discussion. So basically, non-consummation of marriage and infertility, these are the two things which we know. But see, what has happened everywhere in the conference, there is something called as a negative psychology or negative sexology. We always talk about problems and never teach as regards positive psychology or positive sexology. So since these two topics, directly I will come to the final question and ask to each and everybody, and as articulate and crisp and precise and concise you can be, that finally to how to keep that masala in the marriage, and basically how to have something called as a pleasurable marriage and sex. So starting from you, sir, everybody of you contribute, and then we will end with the discussion, and any point which is left, you just tell it. But since the audience and we have to keep the time restriction, you are requested to be as articulate as possible.
To keep this firing away, clarity, exchange of views in between the couple, and the belief on each other should be there. That is the critical, that maintains the fight.
Kya baat?
Unconditional acceptance of the life partner is the most.
Wow.
Both ways. You have to keep sex sexy.
Kya baat hai?
You have to be spontaneous, always positive. Never say no to sex. and never give any pressures to perform to your partners. Always compliment each other. Accept the way he is or she is. Increase your romance. Try and bring in as much variety as you can, because monotony gets you erotically bored. So you need to have variety in initiating. Sex is the same, pen is going in the vagina, but you need to initiate it in a very different way. Every time when you do that, give them surprises. Listen to her, listen to him. Communicate, be transparent, be monogamous.
And you are going to say something as regards intimacy. That day we were having the discussion.
The thing is, regarding desires, see, you can come to know in your married life who has a desire, who's initiating. If the husband initiates, wife understands, yeah, he has a desire. And suppose if she doesn't want to have sex on that day, due to n number of reasons, maybe she's tired or she's depressed, she's had a bad day, all she can say is, let's not have sex today, but let's sleep together. Let's hold each other and sleep together. This will not make him feel rejected. Many times men feel rejected, or women also feel rejected. This is for both the partners. To say that let's not do it today, but let's hold each other and sleep together. That's a better way of communication. Acceptance.
माझं 40 मिनिटाचं लेक्चर याच्यानंतर नॉटी आफ्टर 40 पण जरी क्रिस्प म्हणायला सांगतो की देयर आर टू थिंग्स प्लेजर वर्सेस प्रेशर. So one has to find pleasures rather than pressures. That is most important. Pressures is because we perform or we act.
Very good.
So sex is not an act.
Yes.
It's a relationship.
Correct.
And another word which I really want to object is we always say that we are partners. So rather than partnering, we lovers of each other.
Wow. Yeah.
So sex is one thing which may happen or may not happen. But love will be constant. If love is there, sex चांगला होईल and pleasure मिळेल, pressure न घेता.
Yeah, and Vijay, we were there together at that day, and you said something related to IVF and men. So in short, you tell, and then you tell the final message as regards pleasure.
Now in OPD, whenever planning OPD or this andrology OPD, everyone should go in a couple. Most important thing, don't see the patient if couple is not there, otherwise it's always misleading the diagnosis. If lady goes to gynecologist, till laparoscopic things are work, and then ultrasonic report comes to me. Second thing, those who are in IT sectors, remember it, the big problem is coming due to as they are exposed in isolation. Much more they are addicted to masturbation and pornography. In actual life, they are unable to perform the sex, even up to seniors. And next important,
as regards that demoralizing, you were
yes. What happens by doing IVF? Basically, it's an insult of that person. You are not treating his ED, and later on in the life, once or any time when you get a child by IVF, एक साधं वाक्य निघून जातं. तुझ्यात तर काही दम नव्हता. म्हणून तुम्हाला IVF करावं लागलं. He is so interesting statement. Person he never forgets, and that's the reason I usually am telling every person refer that person first to andrologist, because the sexual dysfunction is one of the major cause of infertility. 50% of cases just by doing ED treatment. Either there are some hidden causes also. Only semen analysis is not the indicator. Every minute your sperm count is changing. So with one report, with one diagnosis, with one event, you should not go for that. And count more doesn't matter for its fertility. And the additional point I want to tell you, everyone is discussing about whether size matters. Does size matter? Actually, how to maintain it. With increasing age, your size keep on going down. चेहरा असा सुंदर ठेवताना पार्लरला जातो. हा दुसरा चेहरा आहे, तोही सुंदर जर नाही ठेवला, किती जर माळ सुंदर असेल तर मणी खूप असतील, दोरा जर नसेल ना माळ बनत.
क्या
आणि दुसरं महत्वाचं, सेक्शुअल ऑर्गन फक्त लिंगच आहे का? टेस्टिस नाही का? टेस्टिसला का विसरता? आय गेट अ पेशंट दुसऱ्यांना for the testicular size is not maintained, so they come to be for testicular implant also.
Okay.
Psychological comfort to that man, if he has atrophic testis, imbalanced testis, one-sided testis, it affects very badly, because I see these surgical cases. So overall, maintenance of your personal, your private parts, your organs, like your face, will maintain. Again, additional factor, always is no single factor. You are asking how to maintain throughout it. So maintain it. Definitely your partner will be with you with a happily, it is a happily married forever. 7 janmo tum ja sakte.
क्या बात है? So just to summarize, my personal experience or whatever I have read, acid test, just ask 2 questions to yourself and to your patients. The first question is foreplay after intercourse, ejaculation and orgasm, which is called as afterplay or a pillow talk. जर का नवरा बायको सेक्स केल्यानंतर म्हणजे आफ्टर 63 and 69 पोझिशन 36 पोझिशन होत असेल तर काहीतरी प्रॉब्लेम आहे. दे आर नॉट एन्जॉयिंग सेक्स. छान एका पांघरुणामध्ये कुशीमध्ये सगळ्या प्रकारच्या गप्पा कट्टा टाकणं बेड लाईफ मध्ये आणि ऑल टाइप्स ऑफ डिसिजन्स ऑफ चिल्ड्रन, ऑफ पेरेंटिंग, ऑफ फायनान्स, इफ दे आर टेकन आफ्टर द सेक्स इज बीइंग एन्जॉयड इन आफ्टर प्ले, देन देअर बेड लाईफ इज गुड. One, so ask that question. And as regards marriage, just ask the question to the partner or rather to the couple की काय ग बाई किंवा काय रे हसबंडा, ओके, द नवरा, तुला हीच बायको किंवा हाच नवरा. वी थिंक ओनली इन टर्म्स ऑफ 50 to 100 years. 500 वर्ष, 1000 वर्ष किंवा 7 जन्म चालेल का? If she or he instantly says no, not at all, मला हा नवरा किंवा बायको पुढच्या जन्मी किंवा 500 वर्ष नाही पाहिजे, the marriage is just going on, okay, it's being dragging. But if he instantly says or she says yes, I want this and this navra or this husband or wife, even for the next 7 janam, that means they are very, very, very happy in marriage. And remember friends, finally to say that there is nothing like a perfect marriage. Perfect marriage is a myth. What should be there? It should be happy, peaceful and satisfactory marriage. Thank you so much.
Thank you, sir.
Thanks for giving me the chance, the organizers, and thank you.
With permission, we all heard 3 terms, namely enjoyment, entertainment, enlightenment.
क्या बात है?
These 3 terms are related to the 3 areas in the body of any human being. At a physical plane, I got good entertainment. If you go to cinema, if you go to any dance, you go to bar, good entertainment, yeah. So that is only up to physical level. I had a good enjoyment last time. I saw the cricket, I watched it, good enjoyment. It's at the psychological level. Enlightenment, it comes between the 2 souls.
क्या बात है?
When that enlightenment is reached by the couple, that couple will be always be couple, they won't do anything extra, they won't separate it, they will good understanding, good bridge of information is flowing without expressing also.
Wow.
But today, our patients are in this generation, everybody is at the entertainment level or at the enjoyment level. Because of this entertainment and enjoyment, people will be doing all sorts of things, either this way or that way. So if we are able to teach counsel these patients, or counsel ourselves, that entertainment, enjoyment should lead to enlightenment. Because our Indian society, though it was a free, open society till 11th century, it was an enlightened society.
Yes.
That's why, though it is an open society, no antisocial activities, no rapes in those days, If the husband is more interested, polygamy is allowed in the society. If the wife is more interested, polyandry is allowed, is acceptable in those society. Never doing anything against law. Everything is doing as per law. So that will happen only when there is a enlightenment.
So that means to avoid the fourth E, that is extramarital, these three E's are important. बहुत ही बढ़िया sir. So you have a very great philosophical background and our entire panel is superb. Thank you so much.
I would like to thank our panelists and moderator sir. I would request Dr. Venkataraman sir to please felicitate Dr. Prasanna Gadre sir.
Sudesh, photo ji.
Sir, please over here.
So he is my dermatological guru sir.
Chairperson, please be on stage, please. Panelists, please be on stage. I would like to request our past president, Dr. Nitin Ekapuri sir, to please felicitate our panelists. Panelists, Dr. Venkataraman sir.
Move ahead with the session. Moving ahead with the session, we are going to discuss about the basic question of the sexology. Does India need sex education? There are two main questions that come out to our mind, that sex and sexuality is a natural and primitive force. So do we need to have education about it? And is the educating new generation, the young generation, making them more aware of the sex and increasing the progressivity? So we have the legend in the field and the chairman of the Council of Sex Education, Dr. Venkataraman sir, with us. For the chairperson, I would like to invite senior anesthetist from Indapur, Dr. Nitin Khare sir, pediatrician and a very active and dynamic Vice President of Phaltan, Dr. Saudamini Gandhi Madam, Senior Physician from Indapur, Dr. Avinash Panbule sir, Gynecologist from Indapur, Dr. Rohidas Thorve, and Physician from Phaltan, Dr. Vikrant Prasad. I request all chairpersons to please be on stage. Please be seated in the arrangements made beside the stage. Till the time the lecture is being said, I would request Saudamini Gandhi Madam to please introduce Dr. Venkataraman sir. Yes, ma'am. Lights are just on and off. Abhijit, how am I?
Hello, good evening everybody. I am here to introduce Dr. G. Venkatraman sir. I have met sir I have seen sir for the first time and I am so much impressed. Dr. Venkatraman sir is a retired professor and HOD, OMC Hyderabad, and Professor DVL, GS Medical College. Sir is President Indian Andropos Society. Sir is Chairman of Council of Sex Education, Parenthood International. Then India representative Asia Ocean Federation of Sexology. Sir is also President-elect of IASSTD and AIDS, past President TSI ADVL. Sir is also member of Academic Committee.
Topic for discussion is, does India need sex education? Just now, our gather can sort out certain issues. We can make the newly wedded couple a more happy, loving couple. As I was telling you, our society was a very open society. Explicitly discussed about the sexual matters in those days, and at the same time, congratulations to all of you. This belt of Pune in the decade of 9th, 10th and 11th decades, centuries, it was a very, very open society in the entire India. It is the place where what today all the 5-star hotels, 5-star societies are performing, called wife swapping, husband swapping, partner swapping games that are going on today, have already occurred here in this land in the year of 8th, 9th, 10th, 11th centuries in the name of Gatkanchaki, that is the name of the game. But in those days, they never exceeded the limits. So that game will happen like this in one hall. Everybody has to take a oath by putting a chakra, dharma chakra. All the participants has to take oath. What happens tonight here should not be discussed, should not be told, should not take any revenge of next day morning onwards. They will take that oath on the chakra and they will have exchange of the partners by exchanging their gloves. So that was the open society, Indian society, that slowly became conservative society from 11th century onwards because of our Islamic rulers and because of our British rulers and because of our Portuguese rulers. And at the top of my voice I can say that because this is the document, Vatsyayana Kama Sutra document. It has been translated into all languages in the world. No country is there which has not translated this document. And they have made it as a teaching module in the Western countries. Today, we doctors are going to the Western countries, getting some training, and now we are teaching our own colleagues as sex education. So this document clearly shows how rich we are in sexuality. How rich was our culture regarding sexual matters. How rich was our society regarding family matters. That speaks volumes about it. I will quote one more example. These are all, you know, these are all because of the sex education. To put that, they have kept it on the walls. Everybody having their own explanation for this. This one is from South India, in Chennai, in the 11th century, 1172 year, at the age of the year, the Chola king performed marriage of his daughter. Daughter next day morning came out weeping to his father and said, "What, ma, why are you weeping?" "Father, I don't know anything what to do in the bedroom. My husband also don't know anything about what to do in the bedroom. I don't know what for we married." This king immediately taken back. I am propagating sex education in the entire my country, but I am failed in my own house. Believe me, everything is Tamil. If anyone knows Tamil, they can read it also. Believe me, the king employed 1,000 sculptors, ordered them within 24 hours. All the sexuality images should be there in the entire town. Next day, all the sexuality images appeared. King asked his daughter, "Go and have a look, ma, so that your mind will be open. Then we will see whatever we looked." The girl went around the town, saw all those things, and consummated her marriage and said, "Father, now I know what to do. My husband knows what to do." That made the king to publish the marital book called Marital Guidance Module. It's not nowadays, it is 1172 years. So that clearly shows how open is our society. Now today, because of these rulers, now we have become more conservative. And another important thing everybody should be proud of is our great Takshila University. This Takshila University is the oldest university in the world. That is, every Indian should be proud of. And this university used to teach sexology in those days. Lot of foreign students from China, from Japan, from Europe, from Middle East countries, these students came and studied here. They went and they became certified as sexologists, went to their countries, they propagated sex education. Such is the greatness of India, and because of these rulers, it became dormant, and we all became now conservative, and now we are hesitant to speak about sexology. Patients are also equally hesitant to speak about sexology. This sexology is in English words. Our words in those days were sambhog, samabhog, equally, samabhog. So both should equally participate, equally enjoy. So that was the concept of sexology. India became conservative country from 11th century onwards because of this. Now presently India is, this is not the Indian size in the 9th century, 10th century. It was a greater India, expanding up to Afghanistan here, expanding up to beyond Indonesia here. Now that has become conquered, came to this much. Even the tip also now POK. The tip also gone now. So only this much is remaining. This much India is 2.4 land area in the world, holding 18% of the population, world population. 2.4 land area, 2.4% of land area, holding 18% of the world population. So you can imagine how much population congestion will be there, how much overcrowding will be there. So if you look at all the 6 countries above, vast land area, less population. Whereas India, less land, more population. And of late, congratulations to you all and including me, who have beaten China blue and black. Now we have taken #1 position in the highest populous country in the world. Last November we took it. So So that clearly shows how much highly productive we are. Yet our infertility clinics are coming to every nook and corner. Yet we are producing more children, more population. So now India occupies, as I told you, 2.4% of land area with 18% of population. With today's literary rate is totally 77.7%. Till today, even today, there are around 22% of people are still illiterate in the country. Because of this inculcated 900 centuries conservative policies, plus illiteracy, plus rampant media influence, all making us not to accept sexuality education, sex education, or whatever name we want to give, we give it, we don't want to accept it. It's because, see the allegations. Sex education is not a subject of education. Time and nature will teach us. Why you want to teach separately? Sex education is seen as a way of multinational companies to sell condoms and contraceptives. My forefathers never had sex education. They have produced children, they are very happy, and I am the product of great-grandchildren. Why you want to now rub on us? Why you want to put it? So these are all the allegations we heard, we read in the paper also. My straight answer for all these questions is, yes, my dear, your great-grandfather never had sex education, but at the same time you are forgetting that your great-grandfather never had these smartphones also. You have to accept. Right? Your great-grandfather never had any radios, any print media, any visual media, any contraceptives, any TV, all these things today available. As a result, lot of inputs are bombarding the brain of this individual today. That's why there is a need for channelizing it or giving it what is true, what is false. That's why today there is a need for sex education. So it is up to you to decide whether this need is there or not. So too many young people now receiving the confusing and conflicting information about relationships, about sex. They are in the transition of childhood to adulthood. So in order to avoid this confusion and contradicting statements, it is we healthcare providers, lot of responsibility is there on our shoulders to give the correct information. Totally we are not the only owners for this. Government is responsible, society is responsible, parents are responsible, we doctors are also equally responsible, and to some extent even school teachers has to take the responsibility. So there are all the owners of the caretakers are stakeholders of this sexuality education. Today our children are growing in a technological world, exposed to more unrealistic, half-baked information, leading to more problems in sexual life. Just now our panelists are also enumerated about a lot of examples how they are facing the problems. So because of this, there is an increased demand from the young people for reliable information which prepares them for safe, productive, fulfilling life. So for this, there is a very great need for sexuality education. This study conducted by CSCPA Hyderabad as well as from the Department of Sociology. So when we interviewed the youth of the society, 59% says, I got information from my friend, he says, sex is nothing but how to get pregnant. 58% magazines giving, it's all about sleeping with someone. 60% go Google, grab anything. 18% my teacher told that is nothing but sexual activity. See how conflicting the information, how unrealistic is this information. That's why there is every need today to give our children, future of the nation, a correct, factual information so that they will become more responsible wife and husband of tomorrow. So for this endeavor, parents, relatives, friends and other persons are all stakeholders, and they should become educated first so that they can give factual education to these children. How many parents are comfortable, including me and you? Let us forget about as a doctors, as we are all parents first, then became doctors. So as a parent, how many of us are comfortable in talking, in discussing the sexuality, sex education, sexual matters with the children? Leave around the patients. So many of us are uncomfortable, including me. So when we are uncomfortable or unprepared to answer this, how can we teach sex education to our patients, or when you go to a school, or when our child will ask, or my son may ask, my daughter may ask. So every time I cannot say, go to Gadre, go to Sanjay. So everybody should have this sound knowledge so that we can answer first honestly, then only we will be answering comfortably with the patients. How many Indian girls and boys know what is meant by fertile period? When is the fertile period? Even today, gynecologists may be knowing or infertilists will be knowing. People are coming saying that my practitioner, my family doctor told to have sex on the 5th day onwards to produce children. Many gynecologists might have heard this. The reality we know, when is the fertile period. How many boys and girls know about types of contraceptives and how to use correctly? This is again very big issue. In India, every year 13 crore condoms are produced. In India, every year 13 crore condoms are produced, but only 2 crore condoms are distributed in the family planning clinics and even sold by medical shops also. Where are these 9 crore condoms are going? Our Indian latex company is producing 13 crore condoms. 2 crores are utilized by the healthcare providers. Where are the 9 crores are going? These 9 crore condoms are going to our Kanjivaram silk sarees, Banaras silk sarees. That silk saree contains latex. Our bathroom chappals contains latex. Our sex toys contains latex. So condom is taking different shapes, not the designed purpose. So how many of us know this? How many boys and girls know about genital hygiene? This is the commonest thing. Many gynecologists, as a dermatologist, as a gynecologist, I get plenty of cases simply because of lack of genital hygiene problems. How many parents are comfortable when why mommy and daddy sleep together when ask me and my sister to sleep separately? How many are comfortably able to say? So we cannot explain it as appealing to these people. When we are able to explain, then no question of anxiety, no question of inquisitiveness will occur. When you just condemn it, inquisitive increases. So they will go and ask the next door people, they will go and ask the classmates, they will give their own explanations, their own unbaked knowledge. All these things will make more complex unrealistic matter. Dear parent, tell me how I was born. Everybody is telling God has given you. Then why are you wife and husband when God is giving? So, on the day when we are able to explain it factually, then the inquisitiveness will come down. Or else, God will give, God will give. So which God will give, mommy? Naughty boys will be there. They will be asking. And propagating the wrong myths in the community. I had a couple long back, somewhere around 1999-2000. Wife and husband both used to come for sexual dysfunction. Counseling treatment was going on simultaneously. Wife became pregnant. I congratulated. Wife says, because of that Swamiji blessings I became pregnant. Then this husband immediately became furious. What you are telling? I have made you pregnant. Why that Swami? So these things will make more cumbersome and makes more. And me when I hold my penis and the scrotum. This is not operating. So this boy, this slide has to do that, he is not doing. He squeezes his penis. So why are you scolding me when I beat my sister? Did I scold you when you beat my mummy? No answer. अब तू छोटा है, जाओ ये बड़ी बड़ी बातें मत कर इधर. इसके बिना कुछ नहीं है आंसर. पापा, ये masturbation क्या होता है? How many of us are comfortable to say about ये masturbation क्या होता है? गंदे गंदे बातें कर रहे थे, चल पढ़ो. तुम्हारा रैंक बढ़ाओ पहले. बच्चे कैसा पैदा होते हैं? So again, so these are all fundamental things where sex education can solve all these things. So now it is up to this august body to decide whether sex education is needed or not. Lot of myths are there. I am focusing here. Children are too young to understand about sex education until they are 18 years old. By 18 years old, if you are not able to teach sex education from the birth onwards, by 18 years everything gone. 2 extramarital relationship, 1 abortion, 1 more wife. So this syndrome will crop in. If teenagers are taught about sex education, they will go out and do it. So this is the real, what you call, insecurity in the minds of the people, in the minds of the country also. No? How many you are all got ourselves vaccinated, and some doctors may be involved in the vaccination programs. How many people got disease by doing a vaccination? Same way, sex education is a vaccination. It won't produce disease. It makes immune for this problem. So it teaches the people, teaches the children, teaches the youth to do experimentation. Sex education says, if you do this, these are all the consequences. So better not to do. So this is the sex education teaches. So we should be able to do that. Children will pick up what they need to know on their own. Yes, absolutely true. When we are as a children, we picked up, because in our days, in the society, no smartphones, no porno magazines, no TV channels. So we don't know, we didn't pick up the wrong thing, we picked up the only right thing, what my mother, my teacher, my friends told. Today, lot of channels to pick up all nonsense things. That's why today there is a great need to channelize or to make them understand properly what is correct, what is wrong. So there is a very much need is there today for sex education. Sex education will give rise to STDs in teenagers. Today, we are the highest producer of STDs in the world. I will show you the slide, what you call census also. By giving correct sex education, we can reduce it to a great extent. Because of lack of sex education, humpty number of STDs, I will give the slides, this one, scientific research information I will share with you. There is a notion that sex education is only for women. Gone those days. Because of Indian society thrown into conservative society, woman is denied of education, woman is denied of this rights of the household. Those days, women need education. That education was given by the great-grandmothers while sending into the bed night, first night bedroom. Today, woman is educated, self-earning, self-sufficient, financially independent. She can take her own decisions. Today, ruling countries, Indira Gandhi ruled country for 15 years. Bandara Naike ruled Sri Lanka for 10 years. Now, how they are more knowledgeable now than the boy. There is a great need for the boys to know about sex education and know about how to respect the woman bodies. If these boys today, present day boys knows about this, there won't be any acid throwing, there won't be any gang rapes. It is all because of the ignorance or irresistibility of the males. So boys need more sex education today. Sex education is another topic. No. Sex education should be there from womb to tomb. That day when we come out of mother's womb, from that day onwards, we need sex education. But it should be age appropriate. We cannot teach penis and vagina intercourse for 3 years child. 3 years child, what we have to teach is, this is nose, this is hand, this is leg. For 10th class student, yes, now you may get to nocturnal emissions. You should be prepared. Now you may get menses, bleeding. So that's normal, physiological. That clearly shows that you are growing according to your age. So it should be, education should be age appropriate. Sex education is considered as a green signal for experiment. It's a very wrong notion that is there in the community. We all healthcare providers should change it. No, it is not like that. See here, this is one scenario that happened in the clinic which I am focusing here. Wife is claiming, doctor, we are married for 6 years. This fellow, in the 6 years, not even one day this fellow bought flowers, buy flowers for me. When I turned to the husband, Hare Baba, he told me whether that is true. Yes sir, to be honest, I never know that my wife sold flowers also. See the ignorance. So this would have been solved easily if they got it premarital sexual counseling or sex education. So now you decide whether the role is there or not. Again, congratulations to all of you. Our youth, not only youth, even our age also, we are the third most watchers of porn in the world. We are the third most. Second first. Population first will be the first. Third most populous porn watchers. See here. Everybody, even if you go to the mall, if you go to railway station, if you go to airport, everybody putting something in the air and doing like this, and they are immersed in it. They don't know where they are walking, how they are walking, dashing each other. Sorry. Sometimes they will be laughing in themselves. Who will think, this will appear so nice, why this will is laughing? What man he is become? but because he is immersed in it. So everybody is with a smartphone now. So everybody watching, girls, boys, women, everybody is watching this one. I have one tenant. That boy works in the IT. Every time we'll make somewhere either at the gate or in the shopping mall. I have only once or twice in the house. Hi uncle, hi, how are you, hero? So when this fellow, he same fellow, when this fellow, when he was here with this, I said, hi. Uncle, are you in the WhatsApp? No, but I am not. Are you in the Facebook? No, I am not in the Facebook. Are you in anything else? Instagram? No. Then I have seen you somewhere, uncle. And you, Pagal, you are my tenant for the last 30 years. So these smartphones, how they are spoiling the relationship. They are unable to make us where we are and unable to place where we are. So this how the smartphone is playing with the lives of the patients. So the country, the third highest, most porno-aware country, talking about sex is a taboo. That is irony here. So that is the real crux here. Because of this, in our country, for every 18 minutes, one rape is occurring. For every 18 minutes, one rape is occurring. So you can imagine how much social atrocity is going on in the country. You see year by year, the rape cases are increasing. In 2012, a sensational case of Delhi Nirbhaya cases occurred. So it shook the entire world, not only India. We expect from then onwards the rape incidence will come down. But see, unfortunately, from then onwards the rape incidence is increasing. This census is produced by Central Bureau of Statistics, not my own census, Indian authentic census. So after the Nirbhaya case, the rape cases are increasing, not decreasing. So this is Nirbhaya case, everybody knows it. So 88 rape cases per day in India. Unfortunately, the conviction rate is 30%. So that is the difference between the action and justice. So these are all the states. That's what I am telling you. After Nirbhaya, the incidence, before Nirbhaya it is 12,000 per year. After Nirbhaya it became 23,000 rape cases. As a result of unwanted pregnancies, 67 abortions in India are unsafe. 67% abortions in India are unsafe. Our gynecologists are not doing. It is the pharmacist, or it is the practitioner, or it is our own indigenous fellows are doing the abortions. Tablet le lo, ho gaya, nahi ho gaya, jab it becomes more complicated and mortality, morbidity. Our Minister of Health and Family Welfare has declared on the Parliament saying that 6,21,000 to 7,70,000 abortions each year are occurring in India for the last 15 years. This is a statement made by none other than our Central Health Minister. So among these, 73% abortions are medication abortions done outside the health facilities. So what we are catering regarding abortions is just meager. 78% is occurring outside. In this, 67% abortions are unsafe and causing nearly 8 deaths every day. 8 deaths because of unsafe abortions every day in India. So you can imagine the unwanted pregnancies and abortions. And all the more, another social turmoil or social malady in India is human trafficking. For every 8 minutes, one child is missing in India. For every 8 minutes, one child is missing in India. So, how can you avoid this? Whether do you feel that sex education do something over here? This August body, let us decide, you decide whether sex education is needed to India or not. These are all the senses. Prompting is there because time is over there. I have to rush and doing that. So it is shame on our part, human trafficking, because she is not a commodity for sale. So now it is you to decide. 10 million children are involved in the prostitution worldwide. In this, in India, 60 lakh commercial sexual workers, among which 3 to 10% are pediatric child prostitution is going on. Forced prostitution, 2 to 3 millions. So all these things you know pretty well. The challenges we are faced, the processions, the affidavits, counter affidavits, courts intervention, Supreme Court. Even this month, Supreme Court is again hearing the legality of the MSM activities and becoming marriage and pregnancy. That court, the case is coming to this Constitution Committee. Then Sanjay was talking about domestic violence. This is another big issue. We all know that domestic violence means, for us, husband beating the wife or male beating the female. That is the domestic violence. Now the scene has changed, my dear. Woman beating the man. Now in Telugu we call Bharya Baditula Sangam. That's called wife को क्या बोला भाई? जोर से बचाओ संघ है. That type of societies are coming up in India. They want to get rid of, protect from wife. Because, see, this is happening. 1 in 3 women and 1 in 4 men are now domestically violence is occurring. So, even the men are now domestically suffering. They are going to the courts. They are putting cases. So this is going on. Previously it was only man to the woman. Now both vice versa. And another thing is, today our youth or newly married couple are not having patience, not having adjustment mentality. Within no time they want divorce. Here I am putting 2 cases. Who took divorce nicely. But fortunately, these big people will get divorce within 10 minutes. For a common man to get divorce, it takes months and months. So this couple, from Andhra Pradesh couple, they got it nicely. But for my patients, they will be coming and beeping that we are going to the court, this lawyer is coming asking next time, that lawyer is coming next time. They are making us to go around the courts only. So today, on average, for every 5 minutes, one couple is getting divorced. For every 5 minutes, one couple divorced. So you can imagine how much divorce is occurring in the country. So then what for we are marrying? What for we are, as a parents, we are performing the marriage? So 12 divorces per hour is occurring. Every year the census of divorce is increasing. So various reasons, and at the same time, again thanks to Maharashtra, dubious distinction, leading the divorce rate also, not only porno consumption, but also divorce. So highest. Divorce getting at earliest age, young age they are getting divorced. At the maximum divorces between below 35 only. And another social malady is pediatric marriages, childhood marriages. Still occurring. Even after 75 years of independence, even after 80% of literacy in the country, still pediatric marriages are occurring. Estimates suggest that about 1.5 million girls under the age of 18 are getting married in India each year. 1.5 million girls. That is 15 lakh girls are underage. among which many unwanted pregnancies. Unwanted pregnancies leading to unsafe abortions, again morbidity and mortality. So because of this, global maternal deaths will increase. So in India, on average, the teenage pregnancies are very high, 8% in the rural India, 4% in the urban India. So high teenage pregnancies. India has apart from this, and a plus point, we doctors are very much tuned to only for negative. You rightly said somebody, because our education is negative. Because we always study diseases, we never study the goodness, healthiness, wellness. Those things will be taught by beauty parlors, what is called gyms, and those things, they will encash that, we deal with only negatives. So here also negatives only, but I want to tell one positive thing. India, though number one in the world populous country, 50% of them are youth. That is the positive thing. But negative thing is, because of lack of sex education, this 50% are doing more experimentation because of the influence of this smartphones, media, TV, channel, physical intimacy, everything. That's why STDs are increasing in the country like anything. My friends, for every second, one STD case is occurring in India. For every second, one STD case is occurring. So you can imagine, now for the last 1.5 hours we sat, we had a panel discussion, we had a talk, how many STD cases we have produced without our knowledge. So that is the rapidity with which the STDs are increasing in the country. Unfortunately, 27% of the sexually active population are bearing the burden. So young youth are more involved in the sexually transmitted diseases, among which 80% are asymptomatic. They don't know that they are having the disease. No symptoms at all. That's why unknowingly they are spreading in the community. For every 10 minutes, one case of HIV. For every second, one STD. For every 10 minutes, one HIV case is occurring in the country. Lot of misconception. See here another misconception. One fellow is asking the other equivalent genius fellow, what is safe-sex boy? You fellow, safe-sex means nothing. When the girl doesn't know your phone number, your name, your address, it is safe-sex. As long as he doesn't know anything, as long as you don't know anything, it is. How many of us, leave alone the patient, how many of us know that 1 + 1 is equal to 3? I will be mad if 1 + 1, how it will become 3? But I am not mad, I am a sex educator. It is 1 + 1 is 3 if nobody uses the condoms or contraceptives. That's clear? How it becomes 1 + 1 3? Do you know that 1 in every 4 couple in the reproductive age group in India struggle with infertility? The fertility is coming down every year. Maybe because of multiple factors. But it's coming down. That's why the infertility clinics we are putting nook and corner. Somebody was telling that don't go for IVF. That is again a blow for the manliness. So these things are acceptable. But because as rightly said somebody, that infertility is not the couple's problem, it is the neighbor's problem. So they will be haunting you. बच्चा नहीं हुआ, चलो उधर जाओ, उधर हो जाता है बच्चे. नहीं ये बच्चे को ले लो. So as a result, lot of infertility, IVF, वो ले ये लो. So because of this thing, the infertility problem is increasing year by year in the country. So now you have to decide whether sexual education is really needed or not. Our youngsters are under threat for sexual abuse and premature relationships. So you decide whether it is needed or not. Today young couples are taking divorce too frequently for trivial reasons, no adjustment attitude, pure ego problems. Today, more nuclear families, nobody to guide, only the media, smartphones are guiding them. Today, more violence and rapes on women and vice versa. Increasing domestic violence. Interestingly, more male victims are increasingly reported. More irregular food habits. Jumani Sahib was telling about this. More metabolic lifestyle disorders. So increasing sexual problems, increasing infertility. More sexual experimentation, more STIs causing morbidity, mortality, infertility and sexual problems and cancers also. Thanks to our Manya Sri Pradhan Mantri ji, he introduced, it was already introduced long back and society refused, the government refused, everybody refused sex education. But our Manya Sri, our Pradhan Mantri ji ne 2018 में in the name of school health education, school health program, he introduced sex education. But no care, no takers. Teachers are not ready to teach. We are not ready to go to the schools. If somebody CSEP is ready, when we apply, yes, we will come and teach you once in a month, one class. No school is giving permission. Though our Pradhan Mantri is telling, yes, 2018 onwards, the sexuality education program is running in the country, is running only on the paper. On the top of my voice, I can say, my friends, by giving sexuality education, our youth will learn to respect all genders, to respect body image. That much I can assure you, provided it should be given factually, correctly, consistently. That's very important. Because why I am using these words is, way back in 1998, when I was educating for sexual health programs in the schools because of rampant HIV, I was doing in those days combined state of Telangana, Andhra Pradesh. I did lot of more than 60,000 programs we did. In that programs, when I went to a school, 2 minutes please, I am closing. We went to school, talked about the contraception, about the premarital sex, how to protect, how to prevent. My class was the last class of the day. Long bell has rang. Class is over. All the students rushed to the canteen, school canteen. Then I was seeing, they are so much hungry. At 4 o'clock, 1 to 2 lunch break, they ate. Again 4 o'clock, they are rushing to the canteen. I too went to the canteen. All people are eating the samosa. They are putting a hole into the samosa, taking out the aloo and eating the aloo only. Something funny, because if somebody offers me, even our Santosh offers me samosa, you will take a bite of samosa. But these children are putting a hole and taking the aloo and eating the aloo only. I went to them, brother, what are you doing? Uncle, I am eating samosa. Yes, brother, I know you are eating samosa, but the way you are eating made me to come all the way nearer to you. Tell me what is the secret why you are putting a hole, taking out the aloo and eating the aloo. Uncle, my teacher told not to eat outside food. With this, now you decide whether sex education is needed for India or not, it's up to you. If chair permits, one small video clip, or else I will skip it, no problem. Thank you.
Thank you. I would request Dr. Avinash Manpuri sir just to give a take-home message from you.
Thank you, Dr. sir. It was an opening batsman for us. He has scored, I think, century on the first time.
Thank you very much.
Though sex is a very interesting topic, but it was a very delicate topic, and many of us were wondered when we have crossed 1.4 billion population, still we need sex education. But you have very elaborately, lucidly expressed your views right from the historical aspect of the 11th century, when the country was very open, and how the sex education was given at that time. And from 11th century onwards, how the society has changed, and how the number of rapes have increased, trafficking has increased. Domestic violence not only to the women, but men are also suffering. That every four person is a
men who has been affected by the domestic violence. Secondly, the number of STD cases, we are topping in the STD cases also, and you have rightly said, we are the third most viewers in the world to see the pornography, because it is all because of the lack of proper education. Because factual education, detailed education, we are not getting. And the very important point you have expressed is that though we are doctors, even we doctors are not comfortable to deal with our children to talk about the sex education and answer their question. So it is the need of the time to educate each and every person, right from womb to the tomb. He should get the sex education, and that will help a lot of us, and it will improve the society's health, I think. So it was a wonderful talk by Dr. Venkatramana. I thank from my heart and from the Akluj for a wonderful talk on this very, very issue. Thank you, sir.
I would request my President Dr. Phaltan sir to please felicitate Dr. Venkatramana sir. Thank you, sir. I would request Dr. Satin Doshi sir to felicitate our chairpersons. Satin Doshi sir, please request Dr. Anmode sir to please be on stage. Dr. Sodamini Gandhi madam, please be on stage. Dr. Meghin Kade sir, Dr. Rohitas Purve.
With this enlightening and educating lecture, we move ahead with the next topic, sex and sexuality, pregnancy and postpartum. I think pregnancy and postpartum is usually considered as a dry spell in a married life. And to disprove that, we have today with us a renowned speaker, Dr. Ritu Santalani. I request ma'am to please be on stage. To chair the session, I request gynecologist, senior gynecologist from Indapur, Dr. Kalpana Khade madam. Gynecologist from Maharashtra, Dr. Ganesh Mahmood sir. Sir has been appointed recently as a secretary of Akluj OBGYN Society, past clinical secretary of Akluj OBGYN Society, and gynecologist from Akluj, Dr. Manisha Shinde madam, and senior gynecologist from Indapur, Dr. Shivaji Khabale sir. I request all chairpersons to be seated.
Request all the speakers to please follow the time. We are conducting the lecture just for 20 minutes, and we'll give a small reminder at the end of 15 minutes. For the lecture.
Hello everyone, a very good afternoon to all of you. Really thankful to dear friend Revati Rane and Dr. Nitin Rane and Dr. Santosh Kadkare for inviting me here. So friends, I'm really delighted to be here in the city of the pomegranates. My greetings to Mukesh sir.
Thank you, organizers. I'm privileged to introduce Dr. Rita. She is consultant obstetrician gynecologist, sexologist, obstetrologist, founder and CEO 360-degree Healthcare Studio, director Shah Women Clinic MPT BC, co-founder MAP, board member of SWWC. With 23 years of extensive experience in obstetrics and gynecology, specialization in fields of hospitalology, infertility,
who has served as a host and keynote speaker for more than 1,000 webinars, summit, training sessions, and awareness events in public at large, organizations, and the medical community. What do you have for sex and sexuality, pregnancy, postpartum?
Very happy action Christian to all of you and happy Eid to our Muslim friends also. So meanwhile the slides are opening, I'm being a gynecologist. I know each and every one of us getting the patients with the problem. Each and every one of us getting the patients regarding the queries for sex and sexual relationships during pregnancy and postpartum. Yes or no? Those who are the practicing gynecologists. I want the reply from the audience. Yes or no? Yes. So friends, before I start my presentation, my all presentations are dedicated to my Durga Mata, whether national or international. So these two lines in my every presentation. Organizers, I will finish in time, don't worry. Ya Devi Sarva Bhuteshu Chikitsa Rupen Sansita Namastasei 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 Namo Namah. So these are the some common queries with which the patients are coming in our OPD. In which month of the pregnancy the sex is prohibited? Is the finger sex is safe during pregnancy? Is the sex is applicable during pregnancy? When did a pregnant woman needs the sex most? When should I stop having sex during pregnancy? Which sex position is not allowed during pregnancy? Which sex position is harmless during pregnancy? What are the unsafe sex positions during pregnancy? And is the sex is safe in the third trimester? Other very important query with the patients, the can sperm go inside during pregnancy? And does the sex helps in the normal delivery? Other queries are why the sex is painful during pregnancy. Other important query, can sex open the cervix during pregnancy? Can water break up during sex? Is the sex safe in the 9th month of the pregnancy? Does the vagina tighten during pregnancy? How long is the sex is allowed during pregnancy? And the queries by the females that how can I satisfy my men during pregnancy? And can we have sex daily during the pregnancy? So coming to the topic one by one. So friends, as we all know, there are the changes in the sexuality which can be significant during pregnancy and in the postpartum period. The literature reveals the experience of decreased sexual desire and frequency of intercourse due to variety of often unspoken physical and psychological factors. Healthcare providers provides a more active role in counseling obstetric patients about the intercourse during pregnancy. As we all are aware, in the first trimester, the nausea and vomiting prevents the female from expressing her sexuality paradoxically at a time when a couple as a unit might feel the closest. Sexual desire and performance are also hindered by the fatigue common in pregnancy. And although this decreases in the second trimester, again in the third trimester the fatigue increases, where the physical changes makes the sexual expression both awkward and uncomfortable. So we know that in the first trimester the patients are usually suffering from the heartburn associated with reflux esophagitis. Besides this, the urinary frequency and urgency can also become the hindrances to sexual response. There is a very recent study published in the National Library of Medicine. This is only in the 2022 March. It is published the changes in the sexual behavior of the partners in each trimester of pregnancy. They had done a big study. In this study, we can take the main lines. There was a statistical significant drop in the sexual intercourse from the first trimester in the second and third trimester. The frequency of masturbation increased in men and decreased in women. The common cause of the sexual abstinence during pregnancy was cited as fear for the fetus by all genders. Again, in the third trimester of the pregnancy, there is a marked decrease in sexual activity, a decrease in the frequency of intercourse, and impairment of the ability to experience orgasm in both nulliparous and multiparous women. Some changes which are experienced by the females: the sore nipple, feeling of fullness after the sex, increased vaginal discharge, abdominal cramping after sex. The breasts are especially tender in early pregnancy. The amount of vaginal secretions normally increases in pregnancy and is further augmented during the sexual arousal. Other very common complaints by the patients is the cervix is more likely to bleed during pregnancy because of the direct trauma from the penile thrusting. The normal engorgement of the genitalia during the pregnancy is further exacerbated during sexual arousal. Orgasm may be accompanied by cramping or muscle spasm. Alteration in the endocrine environment during the pregnancy causes the vaginal discomfort for some women, particularly in the first and third trimesters of pregnancy. The major concern of the females is perceived as loss of attractiveness. About 1/4 of the females, of the half of the pregnant female, feel less attractive than before conception. हे कंप्लेंट घेऊन भरपूर पेशंट येतात आपल्याकडे ओपीडी मध्ये की आता मी गरोदर झाले किंवा की आता डिलिव्हरी झाली, माय हस्बंड लॉस्ट देयर इंटरेस्ट इन मी. A pregnant woman's attractiveness as perceived by herself and her partner correlates positively to coital activity and sexual enjoyment. Again, this study has been supported by the PubMed Journal for the sexual activity during pregnancy. A study has been presented by Monica Strauch and et al. There is a 3-4 major studies which I want to include in my talk. One is by the Master and Johnson, who given the study which declares a decrease in first trimester sexual activity noted, with an increase over pre-pregnancy levels in the second trimester and greatest decline in the activity during the third trimester. Again, one study has been presented by the Felikov and Borgen. They have also found a similar decline in the sexual activity in the first and third trimesters, with the second trimester similar to pre-pregnancy sexual activity levels. That's why patient पण आपल्याला ज्या टायमाला विचारतात आपण सांगतो की फर्स्ट ट्रायमेस्टर मध्ये you have to be careful. Then similarly the other study has been presented by the Kenny and Morris, which found the less sexual activity only in the third trimester compared with pre-pregnancy levels. As we know, there are a lot of behavioral changes. Anatomic considerations, coital positions differ as pregnancy progresses. There was a significant decrease in the male superior position, and in the last trimester, side-by-side position was the most frequently used coital position, whereas the rear entry position, rarely used before pregnancy, also becomes the more popular. Again, this study has been supported by the Solberg and colleagues. So now I am going to show the positions which are recommended for the sex during pregnancy. So these are the some positions. The reverse cowgirl pose, the best position during the pregnancy sex, in which the woman on the top in the reverse facing the feet of a partner, no stress on the belly, and the baby is considered as safe. Another position is the policeman sex position, which when she stands against the wall and spread of the legs, hands on the wall, female can take help of the elbow to stand against the wall. Then laptop sex pose, the male partner sit on the chair and the female partner sit on his laps facing him. It is comfortable even. Stand and enjoy the sex position. This is also very popular. Stand with one leg resting in the couch, chair on the bed, and the male can enter from the behind. This is the safest during pregnancy. Then the corner on the bed, lie on the edge of the bed while the partner needs to stand on the floor near the edge of the bed. It is safe and will not overweight the baby on the belly. Other position position which has been recommended is the scissor sex position. Benefit of having a slower penetration, and it is good for the pregnant woman. Then again, a very popular position during the pregnancy time is the woman on top. One of the best and most preferred position by the pregnant woman during sex. It keeps the baby belly completely out of the way and comfortable. So the position which should be avoided during pregnancy, it is best to avoid lying on the back, especially in the late pregnancy, while when the weight of the heavy uterus can press on the larger blood vessels, as we all know. So now, if the patient is getting a problem by this, so which forms of the sex we can advise at the time of the pregnancy? So a lot of studies in the favor of that also. As we all know, the mutual masturbation as an alternative form of the sex therapy during the later stages of the pregnancy have an enjoyable and intimate moments as a couple. Other very important is the oral sex is a good alternative to vaginal sex, and it requires less amount of the movement on the part of the pregnant woman. Only exception in the oral herpes, because these days सगळे पेशंट गुगल करून येतात, त्यांना सांगितलं पण ते विचारतात की काय मॅडम ह्याच्याने काय काय प्रॉब्लेम नाही होऊ शकत आपण. Again, this study has been supported by one more study has come from the impact of the sexual intercourse during pregnancy on obstetric and neonatal outcome. This is also the recent study published in May 2019. The studies have shown the obstetric and neonatal outcomes were compared between the woman without and with sexual intercourse. As the time is short, I am taking the nutshell of this study. This study has shown the experiences, frequency and timing of sexual intercourse had no significant impact on any obstetric or neonatal outcome compared with those of women without sexual intercourse. As lot of studies are showing regarding the prematurity and low birth weight, but this study has finalized that all these other studies having a very less data failed to find a relationship between the orgasmic frequency and prematurity, PROM, premature labor or low birth weight. Similarly, this study has shown that no overall association between the sexual activity and either fetal distress or perinatal mortality. Regarding this vaginal bleeding, yes, the many women will experience some vaginal bleeding or spotting, especially during the first trimester of pregnancy, and will continue to have a successful pregnancy. Yes, in some patients, the chances of the infection, the vaginal infections and prematurity has been reported. Studies have shown that frequent intercourse and were colonized with Trichomonas vaginalis, Mycoplasma hominis or bacterial vaginosis were at increased risk of preterm delivery. Now there are some studies have come regarding that whether the sex is doing the induction of the labor or not. So there's what's the mechanism has been reported. So studies have shown that this nipple and genital stimulation may induce the oxytocin release from the posterior pituitary, causing the uterine contractions. Prostaglandins released from the mechanical stimulation of the cervix and may cause cervical ripening. Then prostaglandins in the semen may cause the cervical ripening. Continuing to this, at term, the nipple and genital stimulation have been advocated as a way of naturally promoting the release of endogenous oxytocin and prostaglandins released in the semen as a method of cervical ripening. The studies have shown that there are no harmful consequences in the patients with this low risk pregnancies. Only the conditions in which it is strongly contraindicated the sex during pregnancy. This is also very important because so many patients are asking for us this. So yes, the strong contraindications in the cases where the vaginal bleeding, placenta previa, premature dilatation of the cervix,
rupture of the membranes, history of premature delivery, and of course the multiple pregnancy. I am being an ART specialist, lot of patients are conceiving by twins and triplets, so of course we have to tell these patients well. So we always advise the patient for practicing of the smart sex, in which both the partners should follow the smart sex habits even during the pregnancy period to avoid the chances of getting affected by infections. Better to use the condom at each time of the sex. It is important to note to putting herself at the risk of the infection may put the baby at risk as well. So we have to choose the position that make it easier for both the partners. Only some precautions which are very important, which we tell the patient. So do not to blow the air into the vagina while enjoying the oral sex, as it could cause an air embolism to form inside the vagina, which can harm the unborn baby. Avoid the anal sex during pregnancy, as it leads to an infection that can spread to the vagina. Other very important, to use the lot of pillows to prop up the female partner and get more comfortable. So the studies have shown the risk of the anal sex while the pregnancy, that it can quickly cause the unnecessarily aggravation of hemorrhoids, fissures and other bodily conditions. So now what are the risks reported with the anal sex while pregnancy? Studies have shown the switching from anal sex to vaginal sex without due care is very dangerous. The risk of several bacteria which resides inside the anus that do not enter the vagina normally. So studies have shown the anal sex increases the possibility of the transmission of such pathogens. Now coming to the sex after the pregnancy. So friends, we have seen the sex after the childbirth. Approximately 50% of the men expect the sex a few days later, while around 67% of the females can expect the sex in weeks or maybe in months after delivering the child. So a lot of studies have come for this. So studies have shown that when to go ahead for the sex in the postpartum period. Is it like that after 9 months of pregnancy or 14 to 36 hours of labor? Countless weeks of midnight feedings, stitches of pain in the female, she is exhausted, fear of getting pregnant again, this is a very common fear in everyone's mind, fear of waking the baby. Sex is the farthest thing from her mind. Most of the females may need up to 6 weeks or more to recover. For the husband, the sex is a powerful form of reassurance, and 6 to 8 or 12 weeks of unavailability of the partner will make them unhappy. कारण की आपणच्या प्रकार असतो भरपूर वेळ पेशंट डिलिव्हरी झाली की 2 महिने 3 महिन्यासाठी आईच्या घरी असतात. Then again, while at the time of the breastfeeding, woman produces the hormone prolactin, which again reduces the sex drive. So these all are the postpartum changes in the female: the bleeding, vaginal C-section, night sweats, milk production, and mood swings. So friends, here we can see the sex in the postpartum period. The early intercourse could result in the disruption of the sutures, infection, dehiscence, bleeding, and hematoma or fistula formation. However, most of the postpartum complications occur within the first 2 weeks, and very few women are comfortable to have sex until the perineum is healed. A few studies have shown a quicker return to intercourse if no perineal trauma was present at delivery. The studies have shown that this all discomfort is more in the cases of the 3rd or 4th degree lacerations and in the midline episiotomies or in the patients with endometritis. The most common postpartum complication is associated with sexual activity is the painful intercourse. In the review of the literature, the postpartum sexual dysfunction, the 90% of the women resumed the sex by 3 to 4 months postpartum, and sex was usually painful for the first 1 to 2 months but improved with the time. In addition, a lot of studies have come studies have come which shows the increased rate of the painful intercourse and sexual dysfunction have been noticed with operative vaginal delivery and with inconsistent results for cesarean deliveries. There is one study has been presented by the Rowland and co-authors which has shown that the breastfeeding was less likely to have resumed intercourse by the time of the first postpartum visit compared with the women who were not breastfeeding. So friends, lot of studies have showing that the painful intercourse in the postpartum period is vaginal dryness due to the hypoestrogenic state induced by breastfeeding. So once the male partner is interested for the sex, but the female partner's attention is also towards the baby too. So what the studies give the conclusion that there is no required waiting period before to have sex again until the 4 to 6 weeks after delivery, regardless of the delivery method. Actually, the risk of the complications after the delivery is highest in the first 2 weeks after delivery. So they can go for the other methods like cuddling and kissing, which increases the oxytocin levels and act as a bonding hormone.
Hello, sir. Sorry.
Yeah, I'm finishing, last line. So they can explore for the non-penetrative sex practices. I'm just showing the slides, so the first few slides of the sex which is comfortable in the postpartum period. So these are the some positions which has been documented in the postpartum period. So with this, the take-home message, the sex is generally considered to be safe in the pregnancy. Abstinence should be recommended only for women who are at a risk of the preterm labor, antepartum hemorrhage because of the placenta previa. The resumption of intercourse postpartumly should be dictated by a woman's level of comfort. So thank you dear friends for your interest and your time.
Thank you, madam. I would request Dr. Kalpana Khade to please say a few words about that.
Thank you, ma'am. It was a wonderful talk. You have taken care of all the points about the topic. You focus the topic which has never been discussed among the physicians before. In previous era, the information about the source of information about the topic sex during the pregnancy and postpartum was a urban myths or a old wives' tales, but it was a very unreliable information. You have covered all the points very meticulously and very beautifully. And I think the whole the integrity of this topic is to learn or to educate the patient, treating physicians and all the health workers about all these points. Thank you, ma'am.
Thank you.
Thank you, madam.
Thank you so much.
I would request Dr. Shivaji Kavasar to please felicitate madam, Ritu Sarpani madam. Also, I would request other chairpersons also to please join in the stage. I would also request Dr. H.N. Shetty sir to please felicitate. I would request Dr. H.N. Shetty sir to please felicitate the chairpersons. Thank you, sir.
I think without safety and you this picture is incomplete of mine. So please come. And if Dr. Santosh is also here, I want that he should be also in this picture. At least you can join safely and
request Dr. H.N. Shetty sir to please felicitate the chairpersons. Kalpana Khade Madam, Manisha Shinde Madam and Dr. Shivaji Khabale. For the next session, I would request Dr. Mansi Devdikar and Dr. Shrikant Devdikar for the post of MOC, and we'll be heading to the next session on surgical management of small penis and not yet property by Dr. Vijay Devdikar and Dr. Sanjay Deshpande. Over to you.
Thank you, Nitin. Good evening, everybody. I hope you are enjoying the lectures. All the men in the hall, please give me a good thumbs up. Give me a thumbs up. Yeah. Because I had heard a rumor that your thumb size corresponds to your penis size. Please don't confirm it here. I hope you all have your room got booked in the hotel. So we are here for an interesting lecture. How does the surgical management of small size penis? So I'd like to invite our chairpersons, Dr. Mukund Zamdar sir, Dr. Mukund Zamdar is a senior surgeon from Akluj. He is the past president, he is the past MS SJS Akluj. Dr. Abhijit Gandhi, neurosurgeon from Akluj. Dr. Shrenik Shah sir, past past MS Akluj. And Dr. Sanjay Purandare sir.
Deshpande sir from CSCPI and all senior members from Indapur as well as Akluj Medical Association. Now, today we are discussing very much important topic where just for 2 minutes. Till then I will have a discussion. Basically, small penis is the biggest problem in India. Whenever you are discussing about sexual dysfunction, you always discuss about your heroic things what you are performing, but never ever you go for discussion of your dysfunction. And this is a major problem due to which why your colleagues, your people, or the community of people in society, why they don't come in front for their dysfunction purpose. Today, when I am discussing for surgical treatment, directly for surgery, nobody goes immediately if there is any congenital anomaly or any congenital hypospadias. There are so many congenital post-traumatic things and even end-stage dysfunction, where the end-stage dysfunction where their medicine doesn't work. So, what are the recent treatments for the treatment of this small penis? Platelet-rich plasma therapy and surgical management of small penis, either by reconstruction, either by implants. Here, 5 to 6 most important cases I am going to discuss with you. I can show it to you also. Before that, have a theoretical discussion. Usually, I am motivational speaker on Sam TV every Friday at 11 p.m. I have a talk on sex education, sexual awareness and sexual safety. In this talk, I involve directly question and answers from the peoples. We keep it as an open session, and since more than 6 years this we are doing, and I'll say for such a type of branch sexology, nobody wants to come in front. So we have multiple centers at Aurangabad, we have centers in Pune, we have centers in Mumbai. Then we do motivation with books like Sukhi Juna Samantra books in Marathi, Hindi and English languages, and online consultation I do all over the India as well as abroad India also. And we have a HM Products Private Limited company where different types of centrally acting drugs, locally acting drugs, which are testosterone or hormonal therapies. And definitely the treatments for female sexual dysfunctions are equally important whenever we are discussing about the male sexual dysfunction. So, testosterone levels is the main factor which is affecting the penile size during development also, even after birth also. And definitely micropenis many times is idiopathic, or you can say different syndromes like hypogonadotrophic hypogonadism, Prader-Willi syndrome, Kalman syndrome. Such theoretical things definitely will take in short. And in surgical way, why we must go for the surgical steps? Because whenever patient comes to your clinic, definitely whenever you are explaining about surgery, stages, outcome, prognosis, you must also know what is the outcome of the surgery. Now, in micropenis refers to an abnormally small penis. Micropenis is a rare and hormonal genetic issue, and most often the cause doctor will usually diagnose and treat the condition at birth. What is the standard size? When a person's penis is 2.5 standard deviation below the average chest length for their age and the level of sexual development. In that cases, in erect position, if suppose it below 2.5 inches, you can say it as a small penis, because individual to individual and age-wise is a different, and after birth also till 6 months, penile growth usually happens. Now, hormonal issue also you can treat by hormone replacement therapy. Then alternative diagnosis. Which are the alternative diagnosis for it? Many times there is a buried penis, there is a webbed penis, when there is a pad of fat which is just embedding the penis inside. Then trapped penises and surrounding tissue and skin tags, they also can affect. Accordingly, you have to diagnose and go for the treatment. Surgical treatment is a treatment, but before that we go for hormonal therapy. Rather than the theoretical part, straightway on the slides when I will be showing the cases, we will discuss it one by one. These are very interesting cases. congenital anomalies, hypospadias, or you can say even multiple fistulas also, they go for the small penis. So here we'll see enlargement techniques, how the cases we can remove, how the buried penis is treated, and how we have to proceed with the, here we'll see multiple cases, multiple fistulas. It's very common. In our residency, nobody goes for hypospadias repair. Everyone says, refer this to the department, and in urology also people try to reject it, because see, here is the challenge only, by birth there is a loss of blood supply, there is a cord deformation, and whatsoever way perfectly you do it, there has to happen a fistula, and this type of multiple fistula or hypospadias at birth is a very big tension for the parents. How his sexual life will be, how will be married life, and later on what about the issues. Here I will see some operating part over here, how that fistula can cause small penis, and after repair by rotational flap, how we can go for the lengthening also. Here you can see the fistula side, repair of fistula is again a very challenging job. Local just incision and closing with the suture again leads to fistula formation. So here in short I will show you the technique. You have to keep at least, you can say, 2 mm margin along the side of the fistula, so that vascularity should not be compromised. And when we are dissecting, you have to dissect to such a depth so that 2 to 3 layer closure must be possible. So after the dissection, this is the look where you can see the catheter which is going from inside, and unless and until you suture it in 3 layers, again reformation of fistula is very common. So this is the first layer suturing. You have to take it from the depth so that it should be a healthy margin, and by continuing this, you can close next layer not by immediate second closure, but you have to create a flap so that we have to maintain the length also. Otherwise, by same layer closing, you can compromise the length. Here you can see by what way you are creating the flap. Why this flap is created? Because if suppose I will not create a flap and cover the fistula, definitely it's a apparent big deformity. It comes down. So in such cases, laterally we keep on dissecting, and then we rotate the, just a minute. No, just a minute. So by mistake, the button is first day. First day. Keep the contact. We can stand it. I will go for the second case now. Now again, in few cases, many times there is a redundant skin, and in redundant skin, penis again looks in a small size. In such a case, what used to go for? When there is an extra skin, in such a case due to sodding, and sometimes psychologically patient feels that my skin is quite longer. So in this case, you have to preserve the prepuce also, that is most important. So it is called as a partial circumcision. And in such a cases, it is most important, you should not cross the frenulum line. Remember, the preputial skin is most important organ because during sexual activity, it preserves the sensation, and again, when the skin goes back on the corona side, at that time it prevents the premature ejaculation because mechanically it constricts behind the glans of penis. So many times what you feel, this circumcision is a procedure, give it to some junior. So many times I have seen the cases, they cut back beyond the corona, and once the angle of coronal margin is lost, then sensation during sex also is difficult. You can see here how we have to cut it in such a way as if the skin is removed, and when you are suturing, it should be remain same as intact prepuce along with frenulal margin is maintained, and the sensation later on protection part means even after incision of the skin, it has to be maintained. Now again, hypospadias with cordy, without cordy is again challenging operation. In this case, here you can see some pics. How is the abnormal thing? In this case, even if you see the meatus is distally, remember always corpus spongiosum is totally hypoplastic. So you have to cut back that skin, and again you have to create, this is a repair. You can say island tape, you have to take it from the skin. You have to rotate because local repair like a second stage doesn't work, again it fails. So like this way, you have to keep on dissecting, creating urethra. It consists of orthoplasty, granuloplasty, skin cover, meatoplasty, and at the end you get such a results where the length is also maintained. Again, so many times suturing has to be in midline, otherwise what will happen? The meatus is looking some laterally. I'll tell you, cosmetic look of an organ, cosmetic look of a penis post-surgery is again a very important aspect. Now, again, what is the line of treatment for the independent penile implant? Whether penile will be rigid implant, semi-rigid implant, inflatable implant after penoscrotal incision. This is the, you can see the method, proximal first method. We have to first dilate it till the pubic symphysis and put the implant till it will hit the pubic symphysis, and then you have to go for the distal dilatation, and after that you can put in an implant on one side, and once one-sided implant is over, after suturing only you should go for other side implant. So this other side we are performing dilatation till the tip of penis is very much important, otherwise again it will cause the drop jet deformity or like a parotid deformity. Here you can say again proximal dilatation, and after dilatation you are supposed to hit till the pubic symphysis, so that whenever later on there should not be oblique. Sometimes if the implant is loose, in that cases during the act sometimes it can do vibration or move. By what way you can prepare the implant? You have to prepare the length as well as girth. First we have to take with the measure. There are 1 to 2 layers on the implant. These layers to be removed according to Indian penises. Total 9 mm thickness is not required, so 1 layer you can remove and it will reduce by 1 mm. So when you remove this, at the end you have to put in an implant in proximal. After dilatation you can see here how by what way you can. The cap has to be sealed to prevent any type of erosion or irritation to the local tissue, because to the pleura, at the base of pleura we are doing up to that length, and then after fixing we have to go for the distal. Here we have to irrigate that fossa. Many times we have to inject the jelly also, because at corona level the implant is many times is gripped, and at that place you require a force to put in implant. Here both the implants we put inside, it should not be loose also, it should not be tight also, and post-operatively this is the result. At least you can say for 1 month we tell them to avoid the intercourse. In between also after 15 to 20 days we teach them how to conceal it after the intercourse, or we have to give some exercise. Now again, this is a post-op view. This is a case from Bahrain after surgery. He belongs to the you can say police department, came over in India, and You have sickle cell anemia and nobody was ready to operate. Only thing in sickle cell you have to operate within given time and there should not be any stress to. Again, small penis is the biggest problem when patient is having diabetes and hypertension. Friends, remember, due to loss of vascularity, loss of sensation, definitely aging reduces the size of the penis. Even in fact, I get a patient, sir, at least make a penis so that I can pass the urine normally without straining on legs. Like that way they are expecting, and this is a very big social problem. Here you can see the procedure. You have seen already in detail, but I will show it. This is a case how it becomes difficult in diabetic and obese patient. Means the tummy is flat, very difficult, easy for me for the dilatation, but here the vertical penis I have to keep on dilating because due to that belly it is very difficult to dilate. And the cases with diabetes and hypertension, the corporal feel and tissue is not normal. It always keep on gripping your implant as well as your dilator also. So like this way, we keep on dilating, put a proximal implant, distal implant, put in we give some irrigation before putting in implant for the lubrication, or easily you can put it. Here you can see how difficult sometimes to put in implant in such a diabetic cases because at corona is the thinnest part. We have to take care of dilatation because there is a much chances of perforation or any type of blood supply can go off. But still, if you maintain it at the core, use lubrication and somehow lower fitting implant you have to apply. So like this way, after putting both the implants, you can see here the post-operative look. And again I tell you, so many times people get only confidence by seeing his own organ. They get depressed so many times as he's dekh nahi sakta mera organ, that creates a big depression because sir might be it's a big phobia. When they go to toilet, these others penis. I tell you there are 20 types of penises and people must be aware of. This is again a very rare condition. To all practitioners I am telling, circumcision again is a major operation. Catheterization again is a major operation. Any type of handling urethra is a major thing. We handle urethra such roughly, such a badly as if it is a pipeline for peeing only. So remember, it's a very important organ. Our tongue and limb both are very important structure. They are soft one but become hard when they start acting. So what is MIP? Is a megameatus intact prepuce. Means after delivery you feel everything is normal. I can show you the few pictures how it looks. After retraction of penis there is a big hollow. And if suppose without retracting, if somebody don't know about the knowledge, he will straightway go for circumcision. Why? Now see the appearance. Anybody will tell in college for this child? No. Only mother will say there is a flying. And again it goes back. It's like opening and closing. And many times I have seen they go for circumcision. So this should not happen at all because the reconstruction of MIP megameatus intact prepuce is a very difficult. See how it looks when you lift the skin. So always make a habit to hold the skin of a prepuce. Let it to hang. Let it be 1 in 1000, but to save 1 is more equal than that 1000 or 999. Here during dissection there is a cordy also. We have to remove the cordy. We have to make a flap inner prepuce. In 2 minutes I will finish. And in short I will show you the procedure how you have to dilate. See the procedure is a very tight urethra. You can say you have to again catheterization is very important. Don't tell any junior to catheterize in congenital anomalies because there are multiple walls, flaps or false urethras are there, and once you fail in putting a catheter, your total surgery is failed. So it's a very important procedure. Like this, we can see over here, we have to make a total deep incision till buccal fascia because unless and until you go to that level, you cannot release the cordy. So after this, even it is difficult to put in a seizure also. And remember, the appearing meatus in MIP is a false meatus. You have to keep on cutting and go back till you get a urethra wrapped by the spongiosum, and that is the normal urethra. If you suture in between, 100% thereafter to be failure. Here is the flap we are taking. So flap we have to dissect. You have to do it very carefully because already age is 2 to 4 years. Like this way, you have to keep a flaps. You have to go on dissecting without damaging the dorsal complex. Now here you can see complete degrow the urethra, create the flap without damaging the structures. And again, it contains uretroplasty, glandular. Here creation of a glass is very important. Just to create a hole in front and all is fine. I tell you, partner don't like abnormal penis. Remember it. Again, I don't like the penis is the cause of divorces. I used to see in my body, go and get corrected and then come back to me. Even they don't want falling down or other penises with proximal hiatus also, because they don't spur the semen. Now like this you are covering, this is glanoplasty. Layer by layer we are covering, and at the end, this is a very tedious procedure, but the results are very excellent. See, this is the post-op result. You can see how MIP was pre-op and how by operation you can achieve lengthening of a penis. That's why every penile surgery you have to deglue till base of penis, because wherever it is attached, where it is treated, we don't know. Again, in short, I will show you one case, a small penis post-diabetic amputation. बच्चों को झोली में डाला था और झोली में उसने पॉटी किया, उसके बाद डॉग आ गया, उसने पेनिस भी कट किया, टेस्टिस भी कट किया, सब लेके भाग गया. Then how the surgery is done, how it is a challenging job, you can see over here. Just stump was remaining. 2 to 3 plants was there, reconstruction, putting in a half implant, you can say also is possible, and we started dissecting. See the way, just only you have to create one small ring so that it will look like a, this is after pulling off penis, otherwise it is a flat one. We have to make a circle so that it should look like a, the appearance of that stump should also look like penis. Otherwise we see so many penises, whether it is some finger or in abnormal protrusion, you don't understand. Like this way, see how it is possible to achieve the length. Proximally, when we started dissecting, then we got that by mistake when it was cut, and after cutting, you can say with that halfway cut penis, it was totally buried by that surgeon where they have taken that baby. But this we came to know after surgery. Before surgery, we have taken written consent and video consent also. They should not say, because if some good thing happens, they give credit to themselves. And if anything bad happens, they give that credit to doctor. He was unable to do it, that's why this happened. So we always record also the consent. Sometimes we take some legal paper on documentation also, on bond paper also. I did it in 2 cases where it's a very total flat penis. Like this way, dorsally also, if you go, here again remember one thing, sometimes to enlarge or elongate the penis, people used to cut the suspensory ligament. Friends, I'll tell you, if you cut the suspensory ligament, it will start dangling like this. And by any means, if female on top position, she hits, definitely there occurs penile fracture. So whatsoever is possible in this case, scenario is different. We have added by dislocation, how dislocation helps to get the length. Here you can see, now total bare area, now there is no skin, no option was there. We have taken a very thin skin graft. We have to wrap it on the whole penis, and that is the reason you have to be thin, because it should not contract later on. Again, most important thing, on first vision you are seeing so much 4-5 inches, and later on after 1 year it is going back. Again it will create a very big psychological problem to that patient also and partner also. So how it looks after putting in the graft, see this much is the dislocation, means at the end we came with this much of length. And friends, I tell you, length and girth definitely matters to the partner, not for you, because you always feel like a Hercules. But you are Hercules or Hercules, it is decided by your partner. So, so this much length we have received, and after putting in the graft, you can say, now here is the role of surgery. Really, sometimes surgical things are life-saving. I know it's a combination of all. Means psychology is important, it's all things are important, supporting therapy important, familial therapy important. People will say everything was this, where is khana? Then at the end, there has to be a complete chain. That's what I was telling, that complete mala only completes when the thread goes in between. So you cannot compare that he is the hypersexual, these are comparative terms. So these guys were supported with hormonal therapy, post-operatively, you can say a good length, and now with supplementary therapy for only child, we have asked him for ART, now he is performing good length, because still other sources are there of testosterone secretions. And now, last case I will tell you about this PRP, how PRP works. In short, I will tell you, Means I will not go in pathology. I have thousands of cases where we have operated. The patients who are not responding to medical line of treatment, we only explain by giving PRP, we can improve the quality of erection. We will give the size, it's an additional one, orgasm, sensation, and that not with one setting. 2 settings are required. That's the difference of 1 month. The most important by thaw and freeze technique, if you activate the platelets, if the granules are released, that is a special technique by pathologists, then and then only it will, otherwise the platelets are running inside of that also. And only with PRP, I have added, PRP doesn't work. Along with that, I have to go for vacuum erection devices. And again friends, I'll tell you, those patients who come for implant, I made a plan, I don't do implant because the penis is so short, even how 9 mm also to put inside, you can't make smaller than 9 mm. So in that case, what we do, first I do this therapy by hormonal therapy, how PRP is just showing in 2 to 3 size. By giving PRP, see, unless there is a bag of 2 kg, how can you put a 2 kg inside of that? Your bag is of half kg, and person tells him, my penis is this one, make it this one. So I have to explain that, take PRP, take hormones, उसका कुछ exercise तो करो, definitely exercise, yoga, pranayama, as to work on biceps. Why doesn't it overcome our bulbar cavernosus? Definitely, being a sexually active, it maintains the size of penis like a diffuse atrophy. कुछ दिन के बाद appendix के जैसा penis न हो जाए, इतना डर बैठा है. और is a practical thing. और sir, I will post corona 50% population is so badly affected. कोरोना लेने के बाद मेरा सेक्स गया, कोरोना होने के बाद वैक्सीन लेने के बाद मेरा सेक्स गया, वैक्सीन लेने के बाद मेरा लिंग पूरा गायब हो गया. So with this PRP injections and therapy, and at the procedure of injections, 3 injections on one side, 3 on the other side. We do it in a Prilox application and some vibrator we have to use so that we will not get a pain. This is the method. 3 sides we are giving the opening procedure, and 2 times we are repeating. And after that, after injecting, after 15 days, we give this vacuum therapy. See the outcome. It's a combination therapy. Medicine, hormones, then you have to go for this injectable therapy. Later on, then you have to add this one. And after this, if suppose he feels that he is not getting result, then and then only penile implant, unless person will wait, because patients don't know what happens after surgery, and to the remove implants is one of the very tedious. Post-operative friends, we can say this is the last video. Like this way, you can give you total treatment period of every sexual dysfunction patient. At least you should take 3 to 4 months. Unless you treat for 3 to 4 months, at the end you are going for such type of surgical options. By this addition, even for implant also, unless and until I get such a 12 centimeter length ahead, it is not possible for me. Even you also, you are sending me that do implant to this, I will not do it. Because cases I have seen, many times I have removed one-sided implant and on single implant only he is working because it cannot accommodate 9 mm also. So friends, thank you very much. You can ask anything you ask, definitely we'll discuss. But surgical part always comes at the end. First part is only for the congenital things, and remaining ED cases you have to go by these all steps. Okay.
Thank you, sir. Any questions from the audience?
There is a problem with questions also.
Before doing the implant, psychiatric evaluation is compulsory.
Again, every person, every case is different. You cannot say to whom it is required. Already many times, after roaming all over the region, even especially in foreign countries, I will tell you, cost is the cost. The cost is more than 20-25 lakhs. In India, we are doing between the range of, if it is the Boston I am using, it is going 5 lakhs plus. Indian are using 2 to 3 lakhs. That you have to judge yourself. Now again I tell you, don't judge the other doctor's opinion for these patients will be suitable for you. Because how much you are counseling, you are only confident. Only one thing I tell you, let the patient to wait for that implant, for that surgery. जरूरत क्या महत्व जब तक पता नहीं चलेगा, तब तक उसको रिजल्ट का महत्व समझ में नहीं आता. But sometimes it is required for general assignment. I usually take compulsory opinion, permission from the judges also. Sir might be doing psychiatry opinion, even endocrine opinion is also required.
I would request Dr. Sanjay Purandare sir to summarize the talk.
Thank you, sir, for an excellent lecture. This small size penis is many times, I would say, so to say, a problem from many patients' point of view. When there are a lot of couples who come for counseling, especially in cases of infertility, and many of them, they are the male partner. He always feels that his penis is small, and that is probably because of, as sir was saying, because of the onslaught of the pornographic material. So whenever they see that those films, and they always feel that their penis is small, and therefore that gives rise to infertility. And therefore, as Dr. Gandhi was saying, counseling is the most important thing. And we have got to counsel. Here comes the role of the family physician, the surgeon, as well as the psychiatrist, to tell the patient what exactly is small size penis. And once you diagnose that the penis is small, a lot of investigations really need to be done, including endocrinology investigations, hormone therapy, and as you said, the surgical part comes in the last. But once the knife comes into play, the results are more or less guaranteed. I mean, for anything where medicine doesn't help, surgery definitely helps. So that was a very interesting and very informative lecture. You covered a lot of things, including the need for proper circumcision.
This is very important.
Circumcision many times, and as you said, the sickle cell anemia being misdiagnosed. So I have also seen a patient of a young boy of 4 years, and he had undergone circumcision by a surgeon, by a good surgeon, and again there was a lot of fibrosis, and again as if the rephimosis has occurred. So I was called, and we did circumcision again. And again after a few days, he presented with the same thing. Then we came to know, and when we investigated, he was found to have a rare form of leukemia. And then the relatives were very anxious and very, in the mood of fighting that you had done a surgery twice, and how come this has happened? So I think so. Sickle cell anemia should not be missed. Hematological malignancy should not be missed, and proper circumcision technique should be followed. Hypospadias correction and fistula closure was really very well done, and still the penile implants are not that much common, especially in the rural parts. But I think as the cost comes down, this therapy may be available for the patients from rural districts also. And again, platelet-rich plasma is, it's like a panacea for everything. So if you are used properly, I think that holds the key for the future treatment. So thank you for an excellent lecture, sir. Thank you.
Now I would request Dr. Shrenisha sir to felicitate Dr. Vijay Devi, and all the dignitaries on the dais, Dr. Mukund Zamdar, Dr. Akluj and Dr. Sanjay Purandare sir to come on the dais. I would request Dr. Daniel Gandhi sir to felicitate Dr. Mukund Zamdar sir. Dr. Sanjay Purandare sir. Dr. Shrenisha sir. Thank you all. Moving further for the session. Now we have an interesting topic, naughty after 40. To chair this session, let me invite Dr. Satish Doshi sir. Dr. Satish Doshi sir is a senior gynecologist from Akluj. He is well known for his social achievements, and recently he received a Lifetime Achievement Award from the Federation of Oxy Akluj. I would like to invite Dr. J.T. Kaur sir to chair the session. He is a senior physician from Phaltan. Welcome. I would also invite Dr. Dhanesh Gandhi sir to chair the session, senior physician from Akluj. So let us welcome Dr. Sanjay Deshpande sir for his lecture Naughty After 40. I would request Dr. J.T. Kaur sir to introduce our speaker, Dr. Sanjay Deshpande.
He is a chairperson of CSCPA. He is a finance director, IMA, MS, PBS. He was CWC member, IMA, HQ. Honorary Secretary, Indian Andropause Society. First President of Indian Medical Association, Nagpur. Recipient of Golden Lamp Award, CSCPA. He has got best Honorary Secretary of IMA at state and national level, Best Presidents of IMA and at state and national level, Dr. Suresh Nartani Mitramandra Award for Articles on Sexual Medicine by IMA Maharashtra. Sunrise Peace Mission Yogi Manohar Vaidyakiya Seva Ratna Pros.
We will take care of my presentation. Before that, I would just like to thank IMA Akluj and Santosh Khadtare for inviting me here to discuss about all these issues. As from my short CV, you must have understood that there are only two organizations which are very, very important for me in my whole career. And they are, first is Indian Medical Association. Because of involvement in Indian Medical Association, I could become whatever I am today. It's always IMA first, IMA or mass CSCPI. CSCPI is the Council of Sex Education and Parenthood International. It was written wrongly that I am a chairperson right now. Now I am a past chairperson. And my friend Dr. Venkatramana is chairperson of CSCPI. So friends, the concept naughty after 40. How many are below 40 here? बरेच म्हणजे हे लेक्चर तुमच्या जास्त उपयोगाचं आहे. Now of course, as rightly said by Dr. Venkat, Dr. Daipade, and me also in the panel discussion, that sexuality is from womb to tomb. So never matter whether you are 40, 50, 60, 70 or 80. Just before starting the discussion, serious discussion, I came across a lot many patients who are more than 40 years of age. When I started practicing sexology in 2003, I thought that most of the youngsters, adolescents, they will come to me regarding their problems. But nowadays patients, even I have my eldest patient of 83 years of age also. So तेव्हा मला वाटलं 83 years old patients सेक्स प्रॉब्लेमसाठी ट्रीटमेंटला येतात म्हणजे एक जुना कन्सेप्ट आहे, ओल्ड एज ओल्ड कन्सेप्ट इज देयर इन द माइंड that women they cease to have desire of sex after completion of their menopause. म्हणजे मला एका पेशंटने विचारलं होतं की डॉक्टर बायकांना सेक्स किती दिवसापर्यंत असू शकतो, किती वर्षापर्यंत बायका सेक्स एन्जॉय करू शकतात. मी म्हटलं जोपर्यंत त्यांचा पार्टनर सेक्स करू शकतो त्यापर्यंत ते सेक्स एन्जॉय करू शकतात. सो मेसेज इज दॅट अ विमन इज not eager, but she is definitely interested in sexual activity. But unfortunately, after a few years of marriage, say after 40s, men they don't get as they want to do sex with their women or their wives. And म्हणून naughty after 40, usually I do this presentation in dual way. If I go in front of all gynecologists, I talk in favor of women. But now here most of the males are there, so I will take the privilege to talk and support male more than females. So please bear with me. Now when you see a life, there are no references. This is what I felt during my 20 years of practice, and I just put it in here. Why? How man lives. If you see a lifespan of a man, education up to 20-30, then starts earning, own enterprise or establishment up to 40 years. And not what happens in India, once you are settled, you are not satisfied. You want your children also to settle. And if God allows, you will want your grandchildren also to settle. And याला आपलं इथे मोठं नाही करता. Can I see the slide here? So I did not go back. And lifespan of a woman. 40 नंतर असंच होतं. नाही, I'm completing 60 now. Now, but woman, birth to 25 years, usually she is under control of parents. Now, gone are the days now, because this is what I am talking in front of women who are more than 35-40 years of age. But if I talk in front of the women or girls, say 20-25 years, then my talk will be different altogether. But it is for all of us who are more than 40. So parental control up to 25 years, suddenly on one day you are asked to have marriage and have sex with a person who is not very well known to you in past, what we have experienced in our lifetime. And then after 40, these women, they try to come out of shell. Till the year of 40, they have all the burden of child bearing and child rearing. Once their children are 15-20 years of age or 12-15 years of age, they feel somewhat relaxed. They have some more time to experience their own self. And sexuality also is there in their mind. And they want to have sexual life, a very satisfying sexual life. Now this is a fact. Life really does begin at 40. Up till now you are just doing research. So our life begins at 40, and that's why this topic is more important for us. Because till time we have done whatever is required to live in the life. Now we want to live the life. We always say Indian Enterprise Society, people add years to life. But we sexologists, we add life to years. Because sex is a basic necessity. If you see the quality of life of a man or a woman and take out the sex from the life of a man or a woman, then nothing will exist. In the morning only somebody was discussing with me that sex and spirituality अभी दीपक जुमानी बोलने वाले हैं, but उसके पहले हम लोग फिजिकल पे बात ही ज़्यादा कर लेते हैं. क्यों दीपक? आत्मा तो बाद में है, शरीर शुद्धि पहले होना चाहिए. शरीर is mind and soul, they are interdependent on each other. Unless and until you have a sound body, you cannot have a sound mind. So sharir is important, and that's why sex is also important. आपल्या महाराष्ट्रात सांगितलेलं धर्म अर्थ काम मोक्ष 4 पुरुषार्थ सांगितलेले आहे. त्यामुळे कामाला सुद्धा महत्त्व दिलेलं आहे. हिंदू संस्कृती म्हणा किंवा भारतीय संस्कृती म्हणा, आपल्या 4 पुरुषार्थामध्ये मोक्ष सगळ्यात शेवटी आहे. पहिले तिन्ही करायचे. कारण बिकॉज टेल मी, इफ एव्हरीबडी वॉन्ट्स टू अटेन मोक्षा in his young days and don't want to marry, this society will not progress. So sex is most important thing, and it's most important parameter for quality of life. And unfortunately nowadays, what used to happen previously, 40 आले म्हणजे जीवन संपलं, चष्मा लागला 40 आले म्हणजे जीवन संपलं, सेक्शुअल लाईफ संपलं, असं लोक म्हणायचे. But that is not, that thing have totally changed. A person wants to have sex after 40, life after 40, and that's why, though Dr. Venkataraman has told that the divorce rate is more in the early period of life, but now we are seeing that divorce rates are increasing in the 40s, 50s and 60s of age of an individual also. So what can be the reason? Now why sex is important after 40? मला थोडं पाल्हाळा लावायची सवय आहे, त्याच्यामुळे आपण आधी हे का गरजेचं हे पाहू आणि मग पुढे जाऊ. Parenting is more worthy at this stage. Children are more important than partners and spouses. Child takes over spouse relationship. And परत मी सांगतो, parent versus lover. We always choose being parent more than lover once you get children. Because it is said that once you are a parent, you are a parent forever. And we know that even if we are 50, 60 years of age, but our parents will teach us how to behave and what to do and what not to do. So you never become a parent till your parents are. म्हणजे माझ्या मुलाने माझे वडील गेले आणि मग माझा स्वभाव थोडासा बदलला. मला बाबा तुमचा स्वभाव का बदलला? मी तर सांगितलं माझा बाप मेला, आता मला बाप व्हायचं आहे, त्याच्यामुळे मला सुधारायचं आहे. आय कॅनॉट बी ॲज बॅड as a son who is. Now I am a father. So it has a very deep impact on everybody's mind. Our parents are our source of inspiration, motivation, and they are our preachers. And we want that to be continued with our children. So once we become parent, we start reducing our loveliness. This is both for man and women also. And sex kasa hai, either use it or lose it. This example I give, many of my patients, they say, doctor, I don't get desire of doing it for months together. I usually tell him that you do it. Even if you don't perform, do it. Every 10 days, 15 days, 7 days, 3 days, 4 days, whatever you want. So what will happen? I said, 2-4 वेळा एखाद्या वेळेस तो होईल राहील. And another thing is that if you start doing it, then you start getting desire also. Just give an example of all the saints who remain brahmachari till their age. They didn't think about sex from their early age, and that's they were not desirous at all. So performing and indulging sex also increases the desire. One has to tell them, but they feel that these people more than 40 years of age, now we are parents, our priority is more to our children than with each other, and that hampers the sexual relationship. We start taking them for granted, and sometimes that creates the problem which can lead to divorce. And what happens? Sexual paradox after 40, I say, men becomes busy in their lifestyle and women become free or easy because their children has grown up now. They are not too much burdened. But nowadays, what is happening? Even if they are free, they are burdened with their children's education and all other things. So this is lifetime sexuality of a woman. Birth to 10 years, non-sexual, reproductive age group, usually non-sexual, 25 to 40 childbearing, and after 40 relieved from childbearing and exploration of sexuality. And then they want to enjoy. The main basic point here is that inhibition versus pleasure. Till the time they are inhibited by their own self or by the parental teaching or societal learning, but now they want to explore the pleasure. And what about men? Till 15 years sexual development, 15 to marriage, masturbation or having some sex with girlfriend, marriage, sex with wife, and if possible and fortunate with girlfriend also. Old age, no sex or sexual dysfunction, maybe anything can occur. But only thing is that what is different from a woman to these men are, they don't come out of their shell. They are always bothered about their own performance. They want that they should be a performer always. And that is the most important, because any man, all the Dr. Venkat and Dr. Deepak also will agree with me, when they come to us as a sexologist, they feel that whatever their age may be, but they should be as competent, as potent as they were in their early ages. It can't happen. But that sexual performance image which has been built up by the society and himself, they never would. So that is a irony of the situation. Man is always a performer. And if he don't perform, he doesn't perform, then he feels bad and low about it. So that's why during sex counseling, we always say that rather than perform, be a lover. I never say sex. Whenever a couple comes to me, I never say that they should perform sex. I tell them that being involved in love and romance. Because being involved in love and romance will take away the performance pressure. The man may perform, may succeed or may not succeed. But love should be expressed. But for a man, it is expression of love is through sex only. And because of this pornography and other things now, even younger women are also thinking about the same way. So even if in the past, or even in the future or in the present, the role of man is always considered as a performer. And last, but most important is performance versus pleasure. What in women was inhibition versus pleasure, in men it is performance versus pleasure. And after 40s, this he can't cope up. Till 40, maybe because of his health, less involvement in career and job and other activities, he may be able to do that. But 40s, after 40s, 50s, and because of many comorbidities nowadays, the problem of men, they are increasing. So we have to understand the man. That is more important. I always tell, ही slide में तुमचं लक्ष नको द्यायला, आधी ही slide ठेवतो. माझ्याकडे जास्त कपल येते ना, त्यास मी त्या बाईला म्हणतो, अरे तुला ती बाई म्हणते असं कसं त्याच्याने सेक्स होत नाही, सगळे तर करतात, सगळ्यांच्या बरोबर होतं. Even the parents, when they come with their son who has sexual dysfunction, अरे याचंच कसं काय असं होतं, आमचं तर झालं होतं, आम्हाला काही प्रॉब्लेम नाही आला. But it is not, every man is not same. So we used to tell their wives that he is also a human being. For example, if a woman denies sex, म्हणजे मगाचा मुद्दा परत घेतोय मी इथे marital rape बद्दलचा. If a woman denies sex, that is her right. That's a freedom. But if a man denies the sex, it is taken as in a very negative way. Why the society is not equal to both the genders? So there should be gender-free laws, gender-free discussions. A man also can be allowed to not to have sex, but he is labeled as important, more than everything. And that's why that role has to be changed. Society has to change. Now this is usually the account of what Indian couple do for whole 365 days. How many times they should be involved in sex. 48 नाइट्स 4 दिवस मेन्सेसचे पकडले तर 12-48 15 नाइट्स अटेंडिंग समवन इन द हॉस्पिटल. आपल्याकडे असं आहे की कुणी म्हणजे द मेन प्रॉब्लेम वी इन आय एम डिस्कस व्हाट इज द कॉज ऑफ वायलेंस अगेंस्ट डॉक्टर्स इज मोस्ट ऑफ द रिलेटिव्स दे कैन. हमारे यहाँ होता है ना कभी कभी सेक्सोलॉजिस्ट के, मैं आता हूँ जब निकलता हूँ देखता हूँ बाप रे बाहर इतनी चप्पल जूते करे ना, आज बहुत पेशेंट्स होंगे. बाद में मालूम पड़ता है एक ही पेशेंट है, 2 माँ बाप, 2 उसके माँ बाप, इसके माँ बाप, सब पेशेंट है, जूते चप्पल दिख रहे 10. So same thing happens here. So attending some relatives illness, late night dinners and parties, महीने में, हफ्ते में 1 बार, महीने में 4 बार. हाँ राजू हिसाब लगा बराबर. 60 nights no talks due to some quarrels. 4-5 दिन तो महीने में एक दूसरे से अबोलत असतोच ना. 48 nights illness of someone, आज मैं बीमार हूँ कल तू बीमार है. 90 nights exam of son and daughter. I know some couples, they stayed away from each other for 2 years. का तर माझा मुलगा 11वी-12वी नवरा औरंगाबादला, बायको नागपूरला. इथे किती लोकांना असं असेल? असली म्हणजे बऱ्याच लोकांना अनुभव आहे.
इतके लोक नागपूरला जातात.
36 nights some religious function, गणेश चतुर्थी, गणेश फेस्टिवल आहे, नवरात्री आहे, रामनवमी, जन्माष्टमी, अक्षय तृतीया आजच आहे. So there are plenty of reasons religious. 24 nights कुठेतरी बाहेर गेलेलं दोघांपैकी. So total comes to be 345 days, nights. So remaining are only 20 nights. And what happens in these 20 nights also? एका हसबंडची तक्रार आहे की मागच्या 365 दिवसात मी 36 वेळा तुझ्यासोबत सेक्स केला. That is average once in 10 days. And following is the list why I did not succeed more often. 54 times the sheets were clean, but सुंदर सादरी खराब करू नये. 17 times it was too late, आज खूप उशीर झाला. 49 times you were too tired. 20 times it was, आज खूप गरमी आहे. हे आमच्या नागपुरात जास्त होते. 15th time you pretended to be asleep. 22 times you had a headache. 17 times you were afraid of waking the baby. बाळ उठून जाईल. 16 times you said you were too sore. 12 times it was wrong time of the month. 19 times you had to get up early. 9 times you said you were not in mood. 7 times you were sunburn. पर्यंत आपल्याकडे sunburn नसतं. आपण तशीच काळ्या वगैरे sunburn झाले. 6 times you were watching the late show. 5 times you didn't want to mess your new hair style. 3 times you said the neighbors would hear us. And 9 times you said your mother would hear us. And out of this 36 times, what happened? ते चांगलं मजेशीर आहे. 6 times you just laid there. 8 times you reminded me there is a crack in the ceiling. 4 times you told me to hurry up and get it work over with. 7 times I had to wake you and tell you I have finished. And 1 time I was afraid I hurt you because I felt you move. So this is what happens in our day-to-day life. And that's why this is my today's lecture is understand ourselves that we are not giving time to our partners. I am not saying that we are doing crime. I am not saying that we are doing deliberately all these things. But there is responsibility of a man and woman who are married to give time to each other. Time doesn't mean that, like that Rajiv Anand, Dr. Rajiv Anand, he used to say, time is not 2 hours per day. Means in the afternoon you are sitting in the OPD, seeing patients of each yourself and saying we have stayed 2 hours for each other. That's not the point. It's quality that is more important. It's not quantity. Now these are enemies of sex: aging, obesity, sedentary lifestyle, smoking, diabetes, hypertension, coronary artery disease, drugs, bad relationship. So these all of us we know. But मी तिथे अजून लिहिलं की स्लीपिंग पॅटर्न. आपल्याकडे काय होते माहिती का, मॅरिड लोक कितीही श्रीमंत असतो त्याच्याकडे 10 बेडरूम असतात, पण त्याला विचार करा तू झोपतो कसा? तर काही नाही, एका बाजूने मी झोपतो, तिसऱ्या बाजूने माझी बायको झोपते, मधात 2 पोरं झोपतात. I am so worried. What happens? Why it is important after 40 years of age? At least for a man. And I tell this to my patients also. When you are in your early married life, you can get erections very instantly if you are 25-30 years of age. So you may not require privacy. But after 40s, 50s, then you require more time to get erection. You require more things to do for getting an erection. So you require privacy. आणि माझा एक मित्र आहे, ज्यावेळेस मी घर घ्यायला म्हणजे 1999 ची गोष्ट आहे, तो म्हणे संजय 2 बेडरूम फ्लॅट मुळेच घ्यायचा नाही म्हणे. म्हटलं का? पण असं नाही म्हणे, काय होतं म्हणे 2 बेडरूम फ्लॅट घेतला, 1 बेडरूम आपण आईवडिलांना देतो म्हणे आणि 1 बेडरूम आपल्याला राहते म्हणे. आणि मग पोराचं लग्न झालं की आपल्याला ड्रॉइंग हॉलमध्ये झोपा लागते. सो टू अवॉइड दॅट ॲटलीस्ट 3 बेडरूम फ्लॅट घे म्हणे. म्हटलं बघ मी ऐकलं तसं आणि 3 बेडरूम फ्लॅट घेतला. So point is that when you are aging, you require more time for getting excited, sexually aroused. Your partner also needs more time. So good sleeping pattern means at least you should not sleep your children more than 40-50 years of age. म्हणजे मुलं 15-16 वर्षाचे झाले असतात, मग हळूच तो नवरा बाजूच्या रूमवर जातो, त्याला वाटतं थोड्या वेळाने बायको येईल, बायको झोपून गेली असते का, तसा काहीच जागे. म्हणजे 36 वेळा सुद्धा ते कार्यक्रम होत नाही. These are friends in sexual relation. Comfort and security, good diet control, good weight reduction. People are becoming so obese now. So working on diet also helps. Physical exercise ultimately helps in that. Good glycemic control, testosterone, good partner and good doctor like Dr. Venkataraman. आखिरी में होना ना, जवान है तो डॉक्टर तो लगे रहे ना. So what happens? Doctor is important in another way also. One of my patient came to me and he was taking treatment for hypertension and he was taking treatment from a very senior physician. His age was around 55-60 and he told his physician, the doctor, I am suffering from erectile dysfunction. What the physician said? अरे आता तुझे नातवाचे वय झालं म्हणे खेळवायचं, तू कशाला काय करतो? That's why good doctor is also. Society's attitudes towards sexual problems. आता म्हातार झाले, सेक्स करायची काही गरज नाही, वेगवेगळ्या बेडरूमची काही गरज नाही, म्हणजे सेपरेट बेडरूमची गरज नाही, दिवाणखान्यात झोपा हॉलमध्ये, ड्रॉइंग हॉलमध्ये. सेक्स इज नॉट फॉर एज. इट्स नॉट अर्जंट टू ट्रीट सेक्शुअल प्रॉब्लम. आराम से ट्रीट होते रहेगा. The people, I knew one couple who came to me for treatment for non-consummation of marriage for 12 years. So people nobody is dying out of sexual problems. And मग ते 10-12 वर्ष त्यांना सवय होते भावाबहिणीसारखे राहायचे एकमेकांसोबत. What happens? The urge and everything is in initial phases. If you take over it and neglect it, then it becomes habit of the couple. They don't feel that anything is wrong. It's psychological, अपने आप ठीक हो जाए. It may be cured itself. No treatment for these problems in modern medicine. This is very big issue in our society. What they feel that Ayurveda has a very good cure. Or Ayurveda don't have side effects. यहाँ कोई Ayurveda नहीं है ना? तो मैं उनको बोलता इफेक्ट ही नहीं तो साइड इफेक्ट कहाँ से आए? इफेक्ट आ गया तो ही साइड इफेक्ट आएगा ना, लिंग में इफेक्ट आएगा तो आजू बाजू में आएगा. यहाँ कुछ भी इफेक्ट नहीं आएगा. And I can tell you, one of my patient, he spent 10 lakhs rupees. Some people told him to take gold, Suvarna Vasma. Then somebody told him to take Ratna Vasma, Hira Vasma. And that's why they ruin their life because they feel that there is no treatment in modern medicine. And I cannot help these patients. Doctors' attitude is also wrong. Yes, somebody was saying, diabetologists, physicians, cardiologists, psychiatrists, when they are treating patients, they should ask the patients whether they are sexually alright or not. Because what happens, one of my very good friend, cardiologist, he said, patient se kaisa baat karna. After MI, what happens, patient is critical, then he can't do sex, he can't move and do any other things for around 2 to 3 months after getting bypass or angioplasty or something like that. And then he gets physically rehabilitated completely after few months. And then he asked doctor, can I walk, can I run, can I do all the things, everything? Doctor says, okay. But he is not free to ask doctor, can I indulge in sex? No, why? Because he feels that doctor was saving me, I was bedridden, about to knock the door of God. And now if I ask doctor, should I indulge in sex? Doctor will scold me. So it's our duty. And gynecologist also. Sex in pregnancy, sex during treatment of infertility on, you should discuss. Because Dr. J.V. Bhatt used to say, Venkat must be remembering this joke, which is the most important period for a man to get involved in extramarital affairs. 9 months pregnancy of the wife. तो 9 महीने भी सेक्स नहीं, उसके बाद 6 महीना और नहीं. और अगर पहली प्रेगनेंसी तो वाइफ अगर अपने मायके गई तो कभी कभी वो साल भर भी नहीं आती. So what this poor man will do for 1 year and 9 months? So these are the things which we in our routine practice also can do. Even general practice, family physician also can counsel for these many issues. No sexologist or sex counselor will be required for this. Sexual behavior in elderly women, हे आता काही आजकाल इंटरेस्टच घेत नाही. माझा एक मित्र आहे, ही इज अ जनरल प्रैक्टिशनर. उसके पास हस्बैंड वाइफ गए, हस्बैंड को हो गया तो डॉक्टर सर इनच्याकडे थोडं लक्ष द्या. वो बोले मुझे पहले समझता नहीं था कि ये डॉक्टर इनच्याकडे थोडं लक्ष द्या म्हणजे काय. But then women used to indicate that he is not having good sexual functioning. Okay, give me 5 minutes. That's the problem. When I am talking about good sex and all the things, आता 5 मिनिटं बोलले. म्हणून जास्त वेळ द्या. सेक्सॉलॉजीला सुद्धा वाचणार जास्त वेळ. तुम्ही जास्त घेत नाही. प्रॉब्लेमचं सांगत नाही मी. फ्रँक सेक्शुअल प्रॉब्लेम पेक्षा सुद्धा काही या गोष्टी आहेत. जनरल सेक्शुअल डिसइंटरेस्ट. Many people, they are very men, they are happy in IMA, CSCPI, banquets, conferences, Phaltanला जातील तर आग्र्याला जातील तर मथुरेला जातील, सुरतला जातील. When will have time? Sexual boredom, monotony, impaired physical sexuality, attrition by disuse. If you don't do, may not happen. Unreasonable expectation that I used to be at my age of 25, I should be still the same now. Cultural inhibitions. लग्न झालंय, मुलं आहे, बायको नागपूरमध्ये गुंतलेली असते. आणि सगळ्यात महत्वाचं काय आहे, आई रिटायर कधी होत नाही म्हणून आपण वाटतो ना, पण बाप रिटायर झाल्यानंतर काही कामाचाच राहत नाही. You see a role of a man after 60 years. Once he stop earning, he is useless in the house. And a woman who is, म्हणजे वुमन का कैसा है कि जो पैदा होती है ना, तो लोगों को लगता है कि काय कोई बच्चे है ना. अजून आता गेला बराचसा है, लेट अस एक्सेप्ट दैट. एंड देन आफ्टर शी मैरिज, तो भी उसका इतना वैल्यू नहीं रहता है. बट द मोमेंट शी बिकम मदर, उसका वैल्यू एकदम बढ़ जाता है. एंड शी इज मदर ऑफ अ सन, तो वैल्यू और ज्यादा एकदम आसमान तक छू जाता है. और फिर बाद में बच्चों की शादी होती है, लड़कियों की शादी होती है, नाती पोते होते हैं. So she becomes so important in the house, an elderly woman, that the house, she is indispensable. And man, he does nothing. तो उसका 60 साल की उम्र तक पैसा देना हो गया कि then his role is completely over. So man, दूसरा कि औरतों को आपने देखा होगा कि घरात कोणी मुलगी आली तर ती आपल्या आईच्या गळ्यात पडते. त्या बाईची बहीण जरी आली तिच्या गळ्यात पडेल, हा मुलगा आला तरी आईच्या गळ्यात पडेल, नातू आले तरी आजीच्या गळ्यात पडतील. आणि व्हॉट अबाउट दिस मॅन? पण हे लोक तर गळ्यात पडत नाही, त्याची बायको पण गळ्यात पडत नाही त्याच्या, आणि तिला बाकीच्यांच्या गळ्यात पडून इतकं सॅटिस्फॅक्शन मिळालं असतं. त्याचं कारण आहे की that hug, affectionate hug gives immense satisfaction, which is lacking in elderly men. That is very, very important. So I will now rush with the slides. Well, what I wanted to tell has, I think, conveyed. So this is my own presentation. What is 7 habits of highly effective people? आपण सगळ्यांनी ऐकलेलं आहे. नेक्स्ट 7 habits of happy married life केलं होतं. स्वभाव, संवाद, स्वास्थ्य, सत्य, समय, स्पर्श आणि संभोग. Actually, when I started studying on this, I had kept only 3 parameters: स्वभाव, संवाद आणि संभोग. अजून we can extend it to n number of times, but these are the all 7 things which we should keep. We should try to achieve these things so that we can have a very good romantic and naughty life after 40, 50 or 60 also. So I will stop here. Thank you very much. Satya
Any questions from the audience? Thank you, sir, for a wonderful lecture. I would request Dr. J.P. Kaur sir to please highlight the points of the lecture.
Dr. Deshpande has elaborated everything after 40. It is not the 40, it is 50, 60, 70, 80 also. So I feel chronological age doesn't matter. You can have mental age, and whatever we count our age, we should not count like sexual life, we should have mental age, as you correctly said. And I think I can give the message to the audience: we can have hug, TDS or QRD dose, as you write the prescription. So this is very important. Hugging is also very important, as correctly said. And most of the thing depends upon your partner, how he behaves. As you correctly said, after 40, females have more desire and males have less desire. But women has to have their own partner to create the desires. And then they definitely everything will happen. As you correctly last slide was very important, that everybody should follow in their sexual life. And you have given very wonderful lecture for the audience, as well as they will give this message to their patients also and have a good sexual life. Thank you.
Thank you.
I would now request Dr. Satish Doshi sir to felicitate Dr. Deshpande sir. Dr. Kaur sir and Dr. Gandhi sir, please come on the dais. Now I would request Dr. Vivek Gujjar sir to come on the stage and felicitate our chairperson. I would request Dr. Vivek Gujjar sir to felicitate our chairperson. Moving the session further, I would welcome Dr. Aniket Inamdar and Dr. Rohit Fade to move on the program.
I would like to invite Dr. Deepan Jumani to have a talk on spirituality and sexuality. To share this session, I request Dr. Ram Arankar, Senior IMA Leader, Dr. Jamal Doshi, IMA Activist, Dr. Dattatreya Solwalkar, Gynecologist and Obstetric Surgeon from Phaltan.
He is also cybercrime intervention officer, and last but not least, he is the author of bestseller Sex Has No Expiry Date. Over to you, sir.
Thank you very much, sir, for that sexy introduction. It gives me an incredible joy to be amidst you all, lovely ladies and gentlemen, and discuss something which is very sensitive, very special, unique. We've all been speaking about sexual activities, functions, dysfunctions. But I'll take your understanding to a much deeper level as to what is this sexual energy is all about, how pious it is, how important it is. Who doesn't know what is sex? Even small children know what is sex. But we should understand that sex is not a secret, but it's a sacred thing. In this next 25 to 30 minutes, I'll give you some nuggets of wisdom and my observation, and of course studies show that how our bodies, which have energies, in fact our bodies are just vessels of energies, and how these energies work, and how we can maximize these energies for being alive and being lively and have a meaningful life. With pranams to God and thanks to my teachers Dr. Rupi Kapoor, Dr. Prakash Kothari and Dr. Shashank Joshi, I beseech them to bless me always. India is a land of enchantment, the abode of spirituality. Our fascinating country is a spiritual hub, pulsating with life and energy. India is rich in culture, tradition and heritage. It is multicultural, multilingual and multifaceted. India is also a land of Kama Sutra, which is nothing but an epic of aphorisms of love. Sexuality in India has evolved over a period of time and greatly influenced by rulers and religions. Sexuality in India is manifested by our attire, our behavior, recreation, literature, sculpture, scriptures, customs, etc. But what has happened in this modern era with rapid globalization and urbanizations, our sexuality and our values of spirituality are getting diffused and distorted. Why should we discuss about spirituality and sexuality? We are all healthcare workers. So please remember there are 7 dimensions of health which produce aliveness in us. The physical, which is our physiology, hereditary, immunity, the emotional, which makes us what we have, self-esteem, coping with stress, expressing feelings. Spiritual is discovering our inner self, our values, connectedness with the divine. Intellectual means how do we clarify our values, how do we make decisions, how we process the information what we have. Sexual means how intimate we are, gender and procreation and orientations, etc. And social means how we build relationships, how we communicate, what are our skills and what are our insights. And cultural, of course, how do we contribute to the community, how pride we take in our ethnic heritage, etc. All these dimensions, the functions and purpose of these dimensions of health are to work together in balance and harmony to accomplish appropriate goals in life. I'll tell you a small story.
आज आपको एक कहानी सुनाता हूं। एक बार एक नेत्रहीन व्यक्ति गया मंदिर ईश्वर के दर्शन प्राप्त कर। अब जब वहां उपस्थित लोगों को यह ज्ञात हुआ कि यह व्यक्ति नेत्रहीन है, तो कुछ लोगों ने उसका उपहास उड़ाना प्रारंभ कर दिया। वो जिसकी स्वयं की दृष्टि ही नहीं, क्या करने आया होगा? कदाचित ईश्वर से शिकायत करने आया होगा कि क्यों आपने मुझसे मेरी दृष्टि छीन ली। किंतु इन सभी बातों से उस नेत्रहीन व्यक्ति ने स्वयं को पीड़ित नहीं होने दी। वो मुस्कुराया। उसने केवल एक बात कही, माना कि मेरे भाग्य ने मुझसे मेरी दृष्टि छीन ली, किंतु मैं अभागा नहीं, क्योंकि मेरा ईश्वर वो मुझे देख सकता है। स्मरण रखिएगा, दृष्टि नहीं दृष्टिकोण आवश्यक।
If the doors of perceptions were cleaned, everything to a man would appear as it is infinite. Is sexuality and spirituality aligned or antagonistic to each other? Or do they interfere with each other? Or does sexual pleasure interfere in the development of spirituality? Or do we need to suppress sexual energy in order to ascend to spiritual evolutions? Well, nature survives on love. Sex in the right spirit is an extension, a spiritual expression of such love. So sexuality and spirituality have a most healthy connections. I studied a lot of spiritual gurus.
What is the true meaning of spirituality? Well, the word spirit is understood in very different ways. Some people think that spirit means the ghosts, the bodiless beings which are there, the beings which are there, very dark beings, and so they call it spirits. And in Christian ideology, they have good spirits and they have evil spirits. So the good spirits are called the angels, and the bad spirits are called the demons. So many people think that when anybody says spirituality, then it means something to do with these evil or good demons. But that's not the truth. The spirit word should be taken as the essence of something. So the spirituality should be understood as where you are keen to learn what is the essence of your own being. What is the essence of this universe? What is the essence of God, if there is any? And what is the essence of my own presence? I am existing. What does it mean?
Let us see what Ravi Shankarji says.
Science means what? Systematic, logical understanding which leads to something which is beyond the known arena, beyond the arena of known. So here, science is exploring into the unknown through the known. Spirituality is exactly the same. That's why spirituality is where all religions connect. All religion merge in one point, that is spirit.
spirituality is not a certain perspective. Because once you call it a perspective, every individual has a right and have his own perspective. That's going to be one bigness. Truth is not something that you can interpret the way you want and somebody else can interpret the way he wants. Truth cannot be interpreted, it can only be misinterpreted. You can become it, or you don't.
So spirituality is the aspect of humanity that refers to the way individuals seek and express meaning and purpose, and the way they experience their connectedness to the moment, to self, to others, to nature, and to the significant or sacred. Spirituality means any experience that is thought to bring the experiencer into contact with the divine. Well, when we are young, the exuberance of youth is a great joy and delight. But so is the synergistic blend of sexual and spiritual sophistications brought to a relationship by someone who has traveled for so many years. So this synergy of balance in all dimensions of health, but particularly in the coupling of spiritual and sexual selves, provides a rich and subtle reality within which individuals can realize a full expression of their humanness. A beautiful article by Jankana Joshi, who studied the relationship between sexuality and spirituality. She said, if a person is spiritually more inclined, it is likely that his or her overall well-being will also be higher. And lastly, if a person is sexually satisfied, he or she is likely to be more spiritual. The study hypothesized a positive relationship between spirituality and sexual satisfactions, as they both seek wholeness, connectedness, and oneness. Based on the results of this study, we can conclude that if an individual is sexually satisfied, his overall well-being, hedonic and eudaimonic, will also be satisfactory. They used scales to measure sexuality and spirituality, like we have IIEF or SHIP scores. They also have scores. Sexual satisfaction was assessed with global measure of sexual satisfaction, and spirituality was assessed with spirituality assessment scale. So spirituality is nothing but you connect with your own self and love. And where science ends, we know spirituality begins. Till that time we don't believe this is something very true. And love is a state of being. Love in true essence is a spiritual fire. I call sex as soul energy exchange. And what is the difference between spirituality and religion? You know, it's not like putting agarbattis, putting flowers, or going to temples. No. It's love, truth, and gratitude, purification of mind, cultivation of ethical values, developing a prayerful heart, decorate your inner self with good qualities. Religion pleases the society, but spirituality pleases your own self and the divine. We already know there are 4 goals in life: Kama, Artha, Dharma, and Moksha. But according to me, these 4 goals of life should be reversed. You know, among humans, sex is sacred and refined pleasure, unlike animals. So making love, which is the basic outlet of Kama, is definitely art and science. So when we think in true sense the goals of life, this order needs to be reversed, because moksha or liberation is the primary goal towards which everything of us is depending upon. And what is sexuality? Your sexuality now is defined as your sexual orientation, your sexual activity, your capacity for sexual feelings. Sexuality is diverse and deeply personal. Understanding our sexuality is about the sexual feeling and attractions we feel towards other people, not about who we have sex with. The quality or conditions of being sensual is also important. Now, is sexual energy the same as spiritual energy? Spiritual energy comes from pure consciousness, and is the creative energy that of the universe. Without that, you and I could not be alive, and nothing would have life in it, because by life we mean the vitality of pure consciousness. So the trees, the birds, the flowers, you, me, anything that is vital has this energy. Sexual energy is also a creative energy of the universe, because without that you and I would not exist. And it manifests as charm, as love, as attraction, as infatuation, as intimacy, so that there is a merging of consciousness and the emergence of new life. Therefore, the same sexual energy is the same as spiritual energy. Sexual energy is the primal and creative energy of the universe. When we feel attraction or arousal or awakening or alertness or passion or interest or inspiration or creativity or enthusiasm or excitement, friends, sexual energy is at work. And if we nourish these states with our attention and infuse an emotional component to it and experience it with joy, and if we keep it alive in our awareness, then we become passionate lovers of life. This is divinity or spirituality. And how do we manifest sexuality? Sexual desire is sacred and chaste. Without it, there would be no life. Therefore, the suppression of sexual energy is false, ugly, and unchaste. Suppression, resistance, repression leads to extreme violence. We all know about it. All unmet desires lead to psychosomatic issues. All problems related to sex, neurosis, deviancy, sexual misbehavior, violence, abuse can be traced to resistance, suppression, etc. In sex, as in all areas of life, resistance is born of fear, and all resistance is ultimately mental. It applies judgment against what is being felt. Sex becomes a problem when it gets mixed up with hidden emotions such as shame, fear, guilt, or anger. Bliss, carefulness, and playfulness are the essence of sex. Any relationship that comes from joy-giving playfulness ultimately leads to ecstasy. Any relationship that is based on need is ultimately doomed for failure. So how do we improve our experiences? Stop asking how am I doing, what are you feeling, do you love me? To improve your sexual experiences, get rid of your expectations, and to improve the quality of your life and get rid of the need for explanations for everything, just accept and adapt. Sex, if value-based, is transcendence. Sex is a means of escaping a little ego or a little self. It is many people's only experience. In fact, in many languages, the word for orgasm is little death, timelessness, transcendence, union between lover and beloved. So without values, we become spiritually bankrupt. Sexual energy and sexual experience will never cause problem and will always be joyful if lovers share the same values. When you are at the peak of your sexual union, there's union between flesh and spirit. Sex is profane, is sacred. So there's this distinction between that which is profane and that which is sacred. If that sexual union leads to joy and creativity and new life, it is coming together and is divine. My last 2-3 slides. Sexual fulfillment occurs when experience comes from playfulness instead of need. When sex is used to fulfill needs, it is addiction. When sex comes from playfulness, it's ecstasy. When your sex with your chosen partner is spiritual, there is no shame. All too often people feel guilt and shame with sex. When it's spiritual, it's understood that it's not just fun, but a deep experience too. You are vulnerable, you are intimate, you are egoless, you are defenseless, you are spontaneous, you are joyful. And these characteristics are also the characteristics in true nature of your spirit. Hence, sexual energy is spiritual. Look what Osho beautifully says.
For lovers is while they are making love, they should make it a sacred experience. All the religions have destroyed the sacredness of love. They have condemned it as a sin. And the conditioning has gone so deep into the mind that people are making love in such a hurry. As if they want to finish it as quickly. Naturally, if it is a sin, it is better finished soon. Guilt-ridden, their minds completely full of sin. If lovers want to make love a meditative experience, then first thing is to drop the idea that it is sin, that it is something wrong. It is something immensely beautiful, a tremendous gift of nature, of existence, for which you should not be guilty. You should be grateful.
So true intimacy is sacred and divine. Soul is our core consciousness, which is in the sacred form, contains karmic memory and desire. This is true intimacy, and it's timeless and egoless. What science can make things better. Spirituality can make persons better. We are not programmed machines, but we are all owners of the programmable machines. Our sexuality affects everything what we do, and everything affects our sexuality. The same is true with our spirituality, that which is most deeply meaningful to us. We can deny both, but denying both does not mean that they are not existing. They are not both alive in every breath and heartbeat of our life. Sexual scripts are written, and these are the prescriptions. Sexuality and spirituality are natural parts of who we are. We are simultaneously sexual and spiritual. How can we not be? When you look at Ras Leela, it's a pure spiritual and sensual or sexual experience. Look at the freedom, look at the lightness what they feel. It's so important. Look at the freedom, look at the lightedness. This is not a medical talk, it's something spiritual. So I will not tell you take home messages, I give you take home prasadam. Receiving pure love from your partner, caring and recognitions from another confers a great blessing. It affirms us in being who we are, allowing us to say yes to ourselves. When the value and beauty of our existence is recognized, this allows us to relax, let down and settle into ourselves. In relaxing, we open up, and this opening makes us transparent to the life flowing through us, like a fresh breeze that enters a room as soon as the windows are open. This is spirituality and sexuality. My last slide. We must accept that sexuality is not a contradiction to spirituality or morality or goodness. The time has come to stop trying to use spirituality to escape from or transcend the physical. Sexuality is a part of physical life. We are looking to integrate physical with non-physical, not trying to escape humanity through divinity. So developing our sexuality ought to be taken as a part of our a path of spiritual progression. Friends, love is a flow, it's creative, and that is why it flows, brings a contentment. This contentment is much more deeper and valuable than contentment after sex. One who knows the content, this contentment, will never look for any substitute. Just like a person who acquires jewels will never seek for any pebbles or stones. Children should be taught to love from infancy. The myth is that teaching of love will lead the child into a world of sex. This is bullshit, it is groundless. The more love grows in a person, the more sex energy is transformed into sex and is shared. The less love-filled a person, the more sex-minded, the more hatred a person has, the more jealousy, competitiveness, worry and unhappiness will be shared in his life. So we are spiritual and sexual human beings. Spirituality in sexuality is a bond that dignifies intimacy. Sex is a sacred synchronicity of soul. Embrace the act of sex as worship and consider him or her as sacred representation of divine. Exercise your devotion muscle and trash the wrong belief systems into nothingness. Spiritual evolution definitely will be unstoppable. We are not human beings with spiritual experience, but we are spiritual beings with human experience. Spirituality and sexuality are God-made and divine. Thank you all for your love, light.
Now Dr. JAKSON will summarize the sir's lecture in 1 minute.
Sir, very well said. Where science ends, spirituality begins. Spirituality is blind without science, and science is handicapped without spirituality. But here problem is, those who are studying the spirituality are only studying spirituality, and those who are studying the science, they are studying only science. So we have to collaborate both things. Sir, very well collaborated. So science and spirituality, those are parallel wheels of our life. But one thing, what I am studying since last decade, one thing I would like to tell, because here are more scientific people, and I also want to study more on that point. I want to some point elaborate. What God says every day, what we learn every day. That message I would like to tell you. Spirituality and sexuality are opposite. Spirituality stimulates the parasympathetic system. Sexuality stimulates the sympathetic system. Parasympathetic system is calm and cool base. Sexual and sympathetic system is fear and fight base. What is our purpose of life? Purpose of life is stable mind. So what is stable mind? Stable mind when our thought, number of thought level below the 50, and that is the soul conscious stage. So when we produce the high frequency words, the number of thought will be less. When we produce the low frequency words, number of thought will be more. So when number of thought will be below 15, and that is the peaceful stage, and in medical field also, EEG, we know, that is alpha wave, and that is called peaceful wave. When number of thought below the 11, that is lawful wave, and that is theta wave. And when number of thought below the 4, that is blissful wave, that is delta wave, and that is called stable mind. And Brahma Dadi Janki has got world stable mind award. Below the 4 number of thought 4. In sexuality, what happens? In awakening stage, our waves is beta. But in sexuality, waves increase.
Sir, sorry to interrupt you, sir. Very sorry. We are lagging already behind.
All right, no problem. But just I would like to also study on this topic more, and I would like to opinion also. You can message also me, because there is no more doctors studying spirituality. So thank you very much.
Thank you. I would like to invite Dr. Ram Aramkar to felicitate Rajumani. All chairpersons, please come on the stage. Dr. Isan Kulkarni. I would like to invite Dr. Isan Kulkarni on stage to felicitate all chairpersons.
I would request Dr. Santosh Professor, our beloved president, for the dais. I would request him to be quick as we have short of time. I would like to invite a foreign diplomats on the stage, Mr. Dr. Sanjay Raut. I am the president for Phaltan Senior Physician. Dr. Deepak Kaur, President IMA Rural. Dr. Amasya Pawar, past senior VP MS Anesthetist, Biology. I would request Dr. Amasya Pawar to introduce our President Dr. Santosh Professor.
Good evening, everybody. Dr. Santosh Khatri is a practicing pathologist and a sexologist since last 20 years. Right now, he is the president of IMA Akluj branch and chairman of IMA Maharashtra state. And he is a medical officer at the sub-district hospital. And also, he is having very big impact at Akluj. So I request him to present his thoughts on this conference.
नाही सर, हे आमचं ड्रेस कोड आज ठेवला होता. कॉन्फरन्सचं नाव आहे रावरांबा. Good evening. After the legendary talk I am covering my talk within just 5 minutes only. As just Dr. Aniket said, so topic of my lecture is, let's talk about pleasure. Sexual pleasure is the positive sensation that is experienced during the sexual activity. It can be a physical or it can be a emotional or it can be both also. Sexual pleasure is a natural part in the human sexuality and it can be experienced by a variety of ways, including through masturbation, sexual intercourse, oral sex and other sexual activities. There are many factors which can contributing this sexual pleasure, that is touch, arousal, intimacy, communication and trust also. But the real sexual pleasure is we are experienced during the orgasm only. So I am focusing more over the orgasm. So what is the orgasm? Orgasm is also called as a climax, climactic physiological state of heightened sexual excitement and gratification that is followed by relaxation of the sexual tensions and the body muscles. There is a marked feeling of sudden and intense pleasure. Male and females are physiologically capable of experiencing orgasm from the infancy and childhood. While they are engaging in masturbation, sex play may achieve these sensations. So what happens during an orgasm? During an orgasm, people may experience intense feeling of pleasure in the genitals and throughout the body. Orgasms can feel different in each individual. And after an orgasm, face, neck or chest may flushes. So, because of shortage of time, I am running fast.
In men, orgasm is considered the peak experience of sexual pleasure. As a man becomes sexually aroused, the blood gets pulled up in the erectile tissue of the penis. It leads to the erection of penis. The more intense is the arousal, the more erect will be the penis. As arousal continues, the penis cap swells. Muscular tension, heart rate and blood pressure increase and breathing becomes heavier. At this point, scrotum tightens and testes start to leak fluid. This fluid is known as pre-cum and contains alive sperms. Pre-cum also intensifies arousals and serves as lubrication. As orgasm approaches, body movements such as thrusting becomes rapid. The blood pressure, heart rate and breathing reach their peaks. Intake of oxygen also increases. When orgasm is reached, muscles of hands and feet begin to spasm. Then, suddenly, forceful release of sexual tension occurs. During the climax, rhythmic contractions of the muscles at the base of the penis occur. This results in the ejaculation of semen. Furthermore, flushing due to sex may appear all over the body. After orgasm, the body gets relaxed. A deep sense of relaxation, enhanced intimacy and fatigue usually prevails. The penis returns back to its normal size and colour along with other parts of the body. Before men can reach another orgasm, they need rest time to restore. This restoring time, also called refractory period, vary in duration and length among men.
So this is in male orgasm. While what happens in the female orgasm?
Is an important part of lovemaking and masturbation. For it, an intimate and relaxed environment with sexual arousal is necessary. During sexual arousal, the vagina becomes wet and blood flow increases. The vagina becomes darker in colour and the clitoris swells. The labia gets parted and turn outwards. The uterus and cervix are pulled up and backward upwards into the pelvis. This makes the vagina longer. Heartbeat, breathing, and body temperature rises. Sweating also occurs. Furthermore, the skin starts to glow and the breasts swell. The nipples become hard. In some women, the colour of their face, neck, and chest becomes red. The clitoris plays an important role in achieving an orgasm. Mostly, an orgasm can only be achieved by stimulating the clitoris directly. This can be done with hand, mouth, vibrator, and penis. Vaginal penetration causes the vagina to become narrowed, which results in more stimulation of the wall of the vagina and the clitoris. An orgasm happens at the peak point of arousal. The lower part of the vagina, the vaginal wall, the uterus and the sphincters around the anus and urethra contract forcefully and rhythmically. These contractions last from 1 to a few seconds. The initial contractions are the most intense. Afterwards, the interval becomes longer progressively. In general, a woman can have about 10 to 15 contractions, which last from several seconds to a minute altogether. During the sexual climax, heavy sweating, goosebumps, and muscle contractions in hands and feet can occur. Some women also make noises as expression of pleasure. After the orgasm, a feeling of relaxation predominates. An orgasm is a very personal experience, with or without a partner. Some women prefer to be alone after an orgasm.
So, this is all about male orgasm and female orgasm. Orgasm typically occurs as a part of sexual response cycle and often takes place following continuous stimulation of the erogenous zones like genitals, nipples, and perineum. During the orgasm, there is a vasocongestion. After that process in which muscle becomes tense and including both voluntary and involuntary contractions. So, how long orgasm lasts? In female, there is orgasm lasts around 30 to 45 seconds, while in male, orgasm lasts for 5 to 30 seconds. Females are multi-orgasmic and mostly male are mono-orgasmic only. There are different types of orgasm. In female, there is a clitoral orgasm and almost 60% female occurs orgasm during the clitoral stimulation. Another type is the vaginal orgasm, blended orgasm, anal orgasm. I will be running fast because of shortage of time. These are the symptoms: contraction in the vagina, pelvic lifting or thrusting, increase the heartbeats, twitching of the muscle, curling of the toes or fingers, moaning is there, and contraction of the pelvic floor muscles. There are different health benefits: improving pelvic floor region, improve your sleep, helps to look younger. Orgasm boosts the immune system, clear the stuffy nose, relieves pain, and makes less hungry. While others improves the same. Sorry. How to reach orgasm? We will reach orgasm by kissing, touching, giving a sexy hug, erotic talks, words of encouragement, piercing their balls, massage, and power play. These are the different sex positions. Orgasmic sex positions are these. What are the few side effects are there? Hallucinations, sickness, weakness. Some women may cry. These are the few side effects of the orgasm. There are orgasmic disorders also, male orgasmic disorders and female orgasmic disorders are there. So finally, to summarize this topic, orgasms can be different for each individual and do not only occur through the sexual stimulation. People of all gender can have orgasm. Orgasm releases endorphins and may cause an increased feeling of relaxation. And remember, orgasm never lies in between two legs, but it is only in between 2 ears. Thank you.
Thank you, Dr. Fraser, for using talk. Dr. Sanjay Rao, sir, I would request Dr. Manisha Nandi ma'am to present chairperson.
Panel discussion. Topic is adolescent sexuality. I would like to invite Dr. Madan Kamble sir and Dr. Retirani madam to moderate this session. So I would like to invite Dr. Surya Kumar Andare sir, Dr. Rajesh Nade madam, Dr. Isen Kulkarni sir, Dr. Nitin Ekatpure sir, Dr. Sudesh Doshi sir, Dr. Savita Rudar madam as a panel.
Dr. Madan Kamble is MBBS MD. Is consultant obstetrician gynecologist. Is chairperson at Vox Aesthetic Sexual Medicine Committee. Is past elected president of Society. Is a member of Foxy Sexual Medicine Committee. Council of Sex Education and Therapy. Vox is voting for sexual medicine.
So what would you do next?
Well, I would congratulate him telling that you are stepping in your father's steps and you are doing the same thing which your father did at 14-year-old. And this is totally natural, nothing wrong in it. There is nothing to be shameful out of it. And at this age, he is very likely to do this. This is very physiological. And I would advise him about the hygiene to be maintained and not to be entertained in fantasizing some different things on which should be harmful to self. So I don't think it is anything wrong.
Okay, great. On counseling, this is to you, Dr. Rajeshri. On counseling him, he confides about concerns that it might be abnormal and might get a disease if he continues to do so. So how would you approach to this concern?
Yes, masturbation is a natural, very natural thing. हे तर आपण सांगणार त्यांना. पण त्याच्यामध्ये जेव्हा हे विचारधारा तयार होतात, ज्याला आपण साध्या भाषेमध्ये आपण बॅड प्रोग्रामिंग असं म्हणतो, बिलीफ सिस्टीम. त्याच्या सगळ्या डिस्टॉर्टेड बिलीफ सिस्टीम क्लिअर करण्यासाठी आपण त्याला मदत करायची आहे. जसं त्याला हे नॅचरल आहे ह्याच्यामध्ये. आणि ह्या सगळ्या गोष्टी कशामुळे होतात की त्यांना गिल्ट असू शकतो, भीती असू शकते, डाऊट असू शकतो. आणि आपण ते इमॉरल करतोय, अयोग्य करतोय, जे ज्याच्यामध्ये विवेकशक्ती आणि हे सगळे बिलीफ कल्चरली, फॅमिली, रिलिजियस याच्यामध्ये त्याच्यामध्ये जर आले असतील तर त्याच्याबद्दल आपल्याला जजमेंटल न होता खूप शांत पद्धतीने ते कामले हँडल करायला हवं. म्हणजे प्रत्येक जण वेगळा आहे आणि कुठली जनरलाइज सिस्टीम एकाला अप्लाय नाही होणार याच्यामध्ये. तो जो समोरचा व्यक्ती आहे त्याच्या काय बिलीफ सिस्टीम आहे त्याला डिस्टॉर्टेड त्या क्लिअर करून त्याला जास्तीत जास्त आपण हे कसं करू कम्फर्टेबल आणि रिलॅक्स ते आपण पाहणार. थँक्यू.
थँक्यू मॅडम. जसं दोघांनी पण सांगितलं की इथे नॉन जजमेंटल अप्रोच असणं आणि त्यांना ऑकवर्ड न फील होऊ देणं, दॅट इज द मोस्ट इम्पॉर्टंट थिंग आय फील. आणि त्याच्याबरोबरच एक्सप्लेनिंग अबाउट द मास्टरबेशन, वेट ड्रिंक्स की हे नॅचरल फेनॉमिना आहे, प्रत्येकजण करतो. आणि अबाउट एक्सप्लेनिंग अबाउट द प्रायव्हसी इज ऑल्सो व्हेरी मच इम्पॉर्टंट आय फील की हे सोशली uncomfortable situation where they shouldn't land, and explaining that masturbation doesn't lead to STI unless you are using unhygienic measures and it doesn't hamper your future fertility. हे खूप वेळा वाटतं even male and female both masturbation they lead to erectile dysfunctions किंवा female masturbations they lead to further sexual dysfunction problems. हे misconceptions असतात, so that should be clear.
I would like to add one thing.
as Dr. Nare appropriately said, about the beliefs or the faith or whatever social things which are कारण आपल्याकडे बऱ्याच वेळेला ब्रह्मचर्य हेच जीवन आणि विनाशा मृत्यू असं मोठ्या अक्षरात लिहिलेलं असतं. So we have to tell them, no, this is in written books, but it is not physiologically correct, and there is nothing wrong with it. And one more thing about masturbation. Masturbation is not only common to 14-year age kids, it is common until age of 80, and sometimes even I do advocate, Maharashtra lecture for sex in pregnancy. Whenever the husband asks what about sexual pleasure in pregnancy, so if you say that his wife is not comfortable, I do advocate them that he may masturbate with help of his wife, having a non-penetrative intercourse and not touching nipples, which would release sexual tension. So masturbate is not to be stigmatized at all.
Very important point. I feel कि आपण masturbation फक्त adolescent बद्दल इथे discuss करतोय, पण in adulthood also this is very important to be discussed. Sir,
we can add in that it is not going to hamper their fertility in future.
Yes,
It's
yes.
important
That is
because
very
a lot of
important.
the things these kids are reading and they make carried away with them.
So भीती त्याच्यावरची किंवा त्याच्याबाबतचं एक जेन्युइन घडलं किंवा एक असं ते that shouldn't be there. पुढचा सर प्रश्न तुम्हाला नितीन एकत्र सर. Should sex education be a part of school education and from what age?
Yeah. As the previous lecturer they have talked about it. It must be a part of education. It should be started early age, and it must be continued. As someone said that sex is like a dose. So what vaccination? So we practice in pediatricians. We have a lot of vaccination programs and everything. In that vaccination we have regular doses. We have booster doses. We have extra booster doses. So from my point of view, we must have regular sex education in the schools and everything. Even the teachers, the parents, especially the grandparents and the parents must take part in it.
वंडरफुल पॉइंट सर की सेक्स एज्युकेशन प्रत्येक एज ग्रुपसाठी वेगवेगळं आहे आणि विथ एज द नीड फॉर सेक्स एज्युकेशन अँड द कंटेंट चेंजेस. सो दिस इज व्हेरी इम्पॉर्टंट. पुढचा प्रश्न सर रिसेंबल करायचा तुम्हाला. व्हॉट इज द राईट पर्सन टू हू इज द राईट पर्सन टू टीच दिस सब्जेक्ट?
I think psychologists will be better for understanding all these things.
Gynecologist
also. No, in school.
Parents have the main role.
Parents are first at home, but in schools, who will be right person?
Yeah, of course, teachers.
Yes, like parents definitely, but the children, they are not more comfortable, rather they are very, they feel awkward. So I feel rather than parents, teachers. Because most of the time, from their life, first to 10th, they are with their teachers and they feel more comfortable with the teachers. And if we teach them in the school, the teachers, so they will be more open to this. Few times, even kids, they don't open with the parents. They are hesitating, but they open with their teachers. So I think teachers play an important role.
Teachers should be educated so that they should
definitely gynecologists. Gynecologists also are important. But we teach them scientifically. This is uterus, this is ovary, this is vagina, this is penis. So they need more emotional, psychological. They have so many queries about everything. They are confused. They are going through physical as well as emotional turbulence during the adolescence. So I think even the gynecologists play part. So all the whole I'd say samaj. Sir म्हटले तसं parents, grandparents, even the elder brother and sisters should also tell them few things. If the baby, she's around 13, 14 and she'll be getting menses, she gets very terrified when she sees the first blood. So her mother should start for like her from 10 years. You will get periods, now you have developed breast development. So be alert. So she is prepared mentally. So each and every person in the society is responsible and they should.
So it is a team game, I would say, so that a gynecologist, pediatrician, and the psychiatrist, everyone is equally important.
Actually, age appropriate information should be given. Basically, anatomy.
An adolescent reach at puberty. And puberty is the most important landmark in adolescence. That time, I think parent is the first to become a teacher. Should we start teaching them regarding adolescent sexuality?
So I guess for all
what
this,
I think is, rather than classifying it as either a gynecologist or a psychologist or a friend or who are the child finds comfortable to talk with and whom he or she confides. Because as Savita madam said, that children are not very comfortable talking to parents. I would say it is vice versa. The parents are not very comfortable talking with the kids. So whoever the child confides with, maybe his teacher, elder sibling, or mother, or grandparents, they should be taught. And as Dr. Madan said, the education should be age appropriate. For a 3-year-old, it's not telling him what the intercourse is. It is just he naake the kaane the त्याप्रमाणे sexual organs एवढं सांगितलं तरी त्याला त्याच्या भाषेत appropriate आहे. You should be age appropriate.
Right amount of information at right time and at the right age.
आणि मला असं वाटतं की म्हणून हे जे आपण घेतो ॲडोलसंट प्रोग्राम्स वगैरे तर पेरेंट्स शुड बी कॉल्ड फॉर. खूप वेळा पेरेंट्स नसतात आणि पेरेंट्सच मिसअंडरस्टँडिंग त्यात असतात खूप. सो दॅट शुड बी द पॉईंट.
आय वुड लाईक टू ॲड, जसं आम्ही शाळांमध्ये प्रोग्राम्स घेतो गेल्या 15-16 वर्ष, तर ही जी मुलं आहेत म्हणजे 5वीच्या पासून 10वीपर्यंत सगळी मुलं होती आणि त्यांनी मला अर्ध्या तासामध्ये 250 प्रश्न विचारले याच्यावर. सो त्यांनी इतके प्रश्न विचारले आणि त्याची चांगली उत्तरं पण देता आली. तर त्या व्हेरी ओपन, त्या व्हेरी क्युरियस. आणि मग हे सिक्रेट आहे का सिक्रेट जसं आता या सगळ्या गोष्टी. आणि बरेच टीचर सुद्धा कम्फर्टेबल नसतात. जेव्हा टीचर्सना टॉपिक घेऊन लावतात तर ते फक्त एवढं सांगतात की यू हॅव टू अवॉइड अनवॉन्टेड प्रेग्नन्सी, अनवॉन्टेड अबॉर्शन. याच्या पलीकडे सेक्स एज्युकेशन म्हणजे काय, तर ते पण आपल्याला मॉडिफाय करायला लागेल की म्हणजे काय सेक्स एज्युकेशनमध्ये काय काय सांगायचं, कोणाला सांगायचं, किती सांगायचं, कसं सांगायचं, ह्या सगळ्या गोष्टी एक एजेंडा ठेवून व्हायला पाहिजे. पण मुलं ऑकवर्ड नसतात आणि खूप ओपन आहे. तो माझा एक
थोडं एरिया वाईज आय गेस फरक पडतो. तर मला आता आपण पण लेक्चर्स घेतो तर सविता मॅडमला मी विचारलं की तुमचा काय एक्सपिरियन्स आहे. आपण ॲडमिशन टॉक केला जातो किंवा इथे, तर व्हॉट इज युअर एक्सपिरियन्स.
बऱ्याच वेळा येतात स्कूलमध्ये इन्व्हिटेशन, मॅडम तुम्ही लेक्चर घ्या पण तुम्ही फक्त गुड टच आणि बॅड टच सांगा. पण नुसतंच गुड टच आणि बॅड टच काय सांगाल. सो आय टेल देम की वी शुड गिव्ह प्रॉपर सेक्स एज्युकेशन. मग आम्ही जेंट्स टीचरना बाहेर काढू का, मग मुलांना बाहेर काढू का, कशाला. एव्हरी सेक्स एज्युकेशन इज नॉट ओनली फॉर गर्ल्स, इट शुड बी फॉर बॉयज ऑल्सो. If you tell girls and boys together the basic menstrual cycle, so the girls will understand. But the boys, those who they make fussy pads, they are sanitary pads, and she's having so they become more sensitive towards girls and their female. So I think it is like that only की आपण सगळ्याच बाबतीत सगळं ओपन करून सांगायला पाहिजे. Even as Revji said की even the parents should be called for the lecture. आणि मग जेव्हा आम्ही सांगतो तेव्हा मग टू स्टार्ट विथ अगदी मग एज अप्रोप्रिएट. मग आय आस्क देम की तुम्ही कुठल्या स्टँडर्ड्सना बोलवले. तुम्ही जर 7वी 8वी 9वी असेल तर बेसिक त्यांना सॅनिटरी पॅड्स, स्वच्छता, हायजीन, एव्हरीथिंग. But when it comes to the more than 15, 17, 18, so these people requires more information about how to prevent unwanted pregnancies. Advice about contraception, how the use of different methods of contraception, so as to they avoid sexually transmitted infections.
एक्झॅक्टली. इथे मला एक गोष्ट एक अभिमानाने सांगू वाटते की अमॉक्सचे जे सेक्शुअल मेडिसिन कमिटी आहे तर डॉक्टर मदन इज द चेअरपर्सन ऑफ द कमिटी आणि वी आर कंडक्टिंग घे भरारी प्रोग्राम्स इन द स्कूल्स ज्याच्यामध्ये ॲडोलसंट सेक्स एज्युकेशनबद्दल वी आर कंडक्टिंग लेक्चर. जिथे सर मी आदिती थिटे मॅडम पण शी इज अ डर्मॅटॉलॉजिस्ट. सो वी हॅड गॉन टू टेंबुर्णी आणि तिथे इक्वल नंबर ऑफ मुलं आणि मुली होत्या वेन वी हॅड गॉन फॉर द लेक्चर. सो हे खूप क्वचित होतं. जसं मगाशी पण डिस्कस झालं, व्यंकटरमण सरांनी सांगितलं की मुलांना सेक्स एज्युकेशनची गरजच नाही आहे असं म्हणून ते आपण निग्लेक्ट करतो आणि त्याच्यातच खूप प्रॉब्लेम्स क्रिएट होतात. रादर मुलांना जास्त गरज आहे मुलींबरोबर.
Sex education is not only having intercourse or teaching about intercourse. It is about taking away the taboos, making people comfortable. A token which we do at many sex education programs is शाळेत गेल्यानंतर काय करतो तर वर्गातल्या एका मुलाच्या हस्ते एका मुलीच्या हातात सॅनिटरी नॅपकिन देतो. त्या दोघांना अनकम्फर्टेबल वाटलं नाही पाहिजे. नाहीतर काय होतं औषध दुकानात सॅनिटरी नॅपकिन सुद्धा काळ्या पिशवीत कमरेत घालून कशासाठी बाबा इज एनिथिंग रॉंग इन इट, काहीच अडचण नाही ना. हा अनमॅरिड माणसाने कंडोम नेला तर सोडून त्याच्या बाहेर लपून नेला पण सॅनिटरी नॅपकिन लपून नेण्यासारखं काय. हे टॅबू जर आपण क्लिअर केले की बाबा ठीक आहे तुझ्या घरात तुझी आई बहीण मावशी कोणी तिलाही पाळी येणार आहे त्यात वेडवाकडे काहीच नाहीये. सो क्लिअरिंग ऑल दिस टॅबूज मिसकन्सेप्शन्स हे खूप एक टोकन म्हणून आम्ही नेहमी करतो. मुलाच्या असते किंवा मुलीला सॅनिटरी नॅपकिन द्यायला सांगतो किंवा त्यांना समोर दाखवले हे सँटरमेन सगळं वापरतात, चुकीचं काही नाही.
Thank you, sir. Next question is from Dr. Khandari, sir. This is case scenario. 19-year-old unmarried girl comes for consultation. She is in a steady relationship with her boyfriend and she wants to take the things to the next level. She wants contraceptive advice. How will you guide her?
First of all, we have to make him feel comfortable, make her confidence should be built up, and then we have to talk about different contraception available to her, like barrier methods, long reversible contraception methods. Then we have to talk about the sexually transmitted infection,
Yes.
HIV, how she can avoid pregnancy, different methods of avoiding pregnancy like abstinence method, barrier method, or like common contraceptive pills she can be used. And she should be taught all about these things, and then only we can help her. I think
Yes, detailed history should be taken about the frequency of intercourse, multiple partners. We can guess about the chances of STI, etc. Yes, thank you. Next question is, what are the different options available for contraception? Guzar madam.
There are 4-5 methods. First is abstinence. Most commonly used is barrier contraception because it is easily available, affordable. It is they can get it without prescription. It has their own advantages, and it prevents sexually transmitted diseases. They prevent unwanted pregnancies. But there's sometimes disadvantage or the side effects may be they complain about irritation, less sexual pleasure, infection. In girls, they complain of leukorrhea. So barrier is the best option used. Then OC pills. OC pills, they should be taken. We all know OC pills prevent pregnancy by decreasing or inhibiting the ovulation and they're making cervical mucus thick. But the disadvantage, it has to be taken every day. So the compliance is very bad.
Compliance is very important.
Yeah, their own side effects like nausea, giddiness, headache and all. So the third option will be IUCDs. If the previous case scenario said if they are in long-term relation, so IUCD will be the better option. So these three are very well, and then unprotected sex if they have, then the emergency contraceptive pills can be taken.
Okay, yes, thank you.
मला असं वाटतं फक्त याच्यामध्ये barrier in this case, I understand the barrier should be advised.
As a doctor, we do have a role in advising them contraception, but she is a 19-year-old who is unmarried. Now, we are not going to be judgmental or teach her moral teachings, but as a society, it is our responsibility to tell her that indulging in premarital sex may have social consequences. It is very likely that her future fertility may be hampered. It is very likely that she is in multiple relationship or she is in relationship who is unmarried. Then she is likely to have mental stress and future maybe fortune. It is not giving the moral teaching. That we have pravachan द्यायचं नाहीये, but we have to make aware of her, the society in which she lives and the social compulsions which are there. We have to make aware of it.
Thank you, sir. One more twist. Her parents are doctors and they are your best friends. Will you inform them of her intentions? Sanjay sir, in audience. येऊ शकते ॲज अ डॉक्टर ते आलेले आहे. व्हॉट इज अवर ड्युटी?
आणि तरी ऍक्च्युली पॅरेंट्सला सांगायला नको.
Yes.
Whatever you want to tell, you should tell her. First, in the sense that the abstinence सांगायचं ऐकणार नाही, because all over world it has been proven that abstinence only sex education won't work.
But she is serious in her relationship and she want to go ahead. And we have to maintain the confidentiality and privacy of her private life. Yes, I agree with you.
One more important point I would like to add here by ending this discussion, that emergency contraception should be told as only as an emergency and shouldn't be used for contraception. And ते खूप commonly केलं जातं की people use emergency contraception as a method of contraception. Yes sir.
मी पहिले सांगितले हे करताय ते चुकीचं करताय. तुम्ही प्रोत्साहन देताय तुम्ही चक्क पोरांना हे चुकीचं आहे.
पॅरेंट्स म्हणतात
हां
पॅरेंट्स सुद्धा असंच म्हणतात ना.
हा पॅरेंट किंवा डॉक्टर कुठल्याही सणात तुम्ही करा असं तुम्ही सांग म्हणून तुम्ही कॉन्ट्रॅक्ट सांगता मी तुम्हाला प्रोत्साहन दिलं तुम्ही इथून पुढे मोकळा व्हा.
I would agree for this. So we are not promoting them.
मी सांगेन की तुम्ही हे करता ते चुकीचं करताय आता एकदा केलं ठीक आहे इथून पुढे करू नका. हा सल्ला आपण त्यांना द्यायला पाहिजे.
पण याला एक फक्त कंगोरा असा आहे की मग ते आपल्याकडे कधीच येणार नाही. And we'll lose the opportunity. तो एक फक्त एक धोका आहे.
We are not promoting sex. We are preventing pregnancies. We are not promoting sex. We are preventing pregnancies. आणि सगळ्या गोष्टीचं मॉर्निंग आपण घेतलं नाही.
आपण काय करायचं आता साधं होय किंवा नाही उत्तर मला पाहिजे. तुमची मुलगी आहे ती म्हणते मग मी अनमॅरिड आहे आणि मला असंच माझ्या मित्रावर सेक्स करायचा. तुम्ही होय म्हणणार का नाही म्हणाल तुम्हाला उत्तर द्या.
So being a mother of adolescent girl, मला असं वाटतं time is changing.
Yes.
And if my daughter comes to me and asks me, I would definitely give her proper advice. म्हणजे इतकी गोष्टी आता चेंज होत आहेत and they are seeing things. मला असं वाटतं generation has changed. That is what
I agree with Revati. Now the new generation, they openly.
They are very open about this.
Though we are from this culture and आपली generation अशी आहे सर की आपण नाही करत. Obviously नाही.
I will talk to her about this openly.
आपली मुलगी आहे मित्राबरोबर सेक्स करायचा विचारते किती लोक उभारतात हात वर करा.
सर तसं नाही. मी आता म्हटलं की तिला पहिल्यांदा नाही सांगायचं. पण नाही सांगितल्यानंतर ती ऐकेल की नाही हा प्रश्न आहे. आणि म्हणून माझ्यासाठी सांगायचं
तो बाप बरोबर आहे.
नाहीच म्हणायचं पण नाही म्हणून ऐकणार नाही 100% सांगतो तुम्हाला की आज विचारणार.
मॉरॅलिटी सांगायची पण आपण तिला ऍडवाइस पण द्यायचं. ठीक आहे. थर्ड केस.
In this age group.
हो फार इम्पॉर्टंट आहे.
Failure rates in this age group is higher as compared to the adult.
And teenage pregnancy is a major issue. So moving ahead, third case scenario. आता इथे पण 20-year-old female student. आता ही मॅरिड अनमॅरिड आपण नको विचार करायला. Comes to your clinic. She recently had unprotected intercourse with new partner and she has had 2 other partners in the past. So obviously थोडं unmarried कडे जाते. She is asymptomatic but worried about contracting infection and asked to be tested for everything. SM Kulkarni sir, how would you approach this case? म्हणजे हिस्ट्री आणि हे कसं विचार?
First of all, I will take her in confidence and if possible with her partner. I will call both. I will take detailed history about previous partners or some genital examination, symptoms like urinary burning, then discharge, any ulcers, scrotal swelling, etc. Then I will examine her in the private room confidentially and I will examine for the rash over body, any itchy rash, then any ulcer, any swelling in the groin, and similar examination I will do of male partner also. Then abnormal vaginal discharge purpose, everything I will check, and if she has pain in lower abdomen, dysmenorrhea, menorrhagia, irregular menses, then common causes of vaginal discharge are vaginitis, trichomoniasis, candidial or bacterial, and cervicitis, gonorrhea or chlamydia. The common causes of urethral discharge are gonorrhea and chlamydia.
Sorry to interrupt you. यू सर. आपण हे थोडंसं स्किप करूयात. फक्त आय वुड लाईक टू हायलाइट हिअर, आपण आता पीजी करताना वी ऑल हॅड इन द वी वर्क मोस्ट ऑफ अस वी हॅव वर्क इन गव्हर्नमेंट हॉस्पिटल आणि सगळे क्लिनिक्स आपल्याला होते तिथे. सो ओनली पॉइंट टू बी नोटेड मला असं वाटतं इथे की कम्प्लीट ट्रीटमेंट ऑफ द डिसीज इज व्हेरी इम्पॉर्टंट. जिथे पर्टिक्युलरली जिथे आपण PIDला देतोय तिथे 14 डेज ऑफ थेरपी दिली गेली पाहिजे. रोज 5 आणि 10 दिवस देऊन आपण रेजिस्टन्स वाढवतोय आणि रेस्ट ऑफ द थिंग्स सगळी ट्रीटमेंट वी ऑल नो, वी ऑल आर एक्सपर्ट. सो बोथ सिनारिओ.
17-year-old female student comes to you and explains that she has recently been attracted to her best friend who is also female. She feels afraid to accept this as well. Her other friends are attracted to the people of opposite gender. She thinks that she will be ostracized by her peers and the society. How will you manage, Dr. Sudesh Doshi?
Now, if any person is attracted towards same gender, it is not necessarily always a sexual attraction. आपण इतक्या वेळाकडे जाऊन फिरत होतो, आता आपण homosexual person आहे किंवा at this age they are defining their gender identity. Sometimes they may feel very good with their friends, they may feel good touching their same gender person. So it is not necessary that to be ostracized or stigmatizing that you are a homosexual or a lesbian, something like that. But if she has some different orientation, she needs to be counseled. She needs to be told that this is, though not abnormally said, but this is rare. This is something different from the normal, and she needs to be counseled properly in an unbiased way. And again, I would say, as Dr. Satya Doshi said, that we have to follow the rules of the morals of the society. Though we will give their unbiased opinion, some morals of the society are to be told to them, and it is our part as a educator, as a parents, as a doctor, to make them well aware of the rules and norms of the society. We cannot enforce on them. They are ऐकतीलच असं नाही, but our part should be as an educator.
सरांनी छान एक्सप्लेन केलं त्याच्यामध्ये, पण ॲज अ सायकॅट्रिस्ट जेव्हा माझ्याकडे होमोसेक्शुअल्स येतात तेव्हा ते त्यांच्या सेक्शुअल ओरिएंटेशन मध्ये फर्म असतात. जसं की इकडचे जसं एक आहे की त्याला तो जरी मेल असला तरी त्याला फिमेलचंच ओरिएंटेशन होतं आणि त्याला त्या कम्युनिटीला जॉईन व्हायचं होतं आणि घरातले परमिशन देत नव्हते. हा त्यांचा 3-4 वर्षाच्या गोष्टी असे बरेच केसेस आहेत. तर त्याच्यामुळे इट विल बी इंडिव्हिज्युअल अप्रोच. सोशल नॉर्म कुठेही आपण हे न करता, जसं मी त्यांना साधं उदाहरण सांगते, आपण दोन्ही बाजूनी गाडी चालवतो आणि जेव्हा आपण डाव्या बाजूनी गाडी चालवतो आणि तुम्ही जर समोरून आला तर ऍक्सिडेंट तर होणारच आहे त्याचे, आणि तुमचाही होणार आहे, तुमच्या बरोबर अनेकांचा होणार आहे. हे नॉर्मल उदाहरण जेव्हा त्यांना सांगतो, जेव्हा तुम्ही सोसायटीच्या नॉर्मच्या ऑपोजिट चालणार तेव्हा त्याचे कॉन्सिक्वेन्सेस तुम्हाला भोगायला लागतील, त्याचे परिणाम आणि त्याची सगळी जबाबदारी तुमच्यावर असेल. तर त्याला कुठेही न घाबरता दॅट इज ओके. सेक्शुअल ओरिएंटेशन असं असणं काही चुकीचं नाहीये, कारण इट इज कम्प्लिटली बेस्ड ऑन युअर प्री फ्रंटल कॉर्टेक्स. तुमचे सगळं ब्रेन बायोलॉजी पूर्ण वेगळी असते. जसं जमात आपण रेसिझम आहे तसंच हे पण ह्याच्यामध्ये आपण रेसिझम आता करत नाही, तर ह्याच्या आताही सेक्शुअल ओरिएंटेशन वेगळं आहे म्हणून आपण त्यांना काही हे नको करायला, म्हणजे जसं आपण म्हणतो की त्यांना बाहेर नको काढायला जमातीचे, पण हे त्यांचा पर्सनल चॉईस आहे.
जसं मला वाटतं की डावखुरा असणं हे जसं पूर्वी आपण उजव्या हाताने मुलांना खायला सांगायचो, तसं आपण हे सेक्शुअलिटी शुड बी ऍक्सेप्टेड आणि वी शुड बी नॉन जजमेंटल अबाउट इट. ती फेज पण असू शकते, पण वी हॅव टू बी ओपन अबाउट इट.
येस.
Sudesh sir, what is your opinion about the section 377?
377 actually says about sex against the order of nature. Against the order of nature म्हणजे काय म्हणजे कुठे डिफाईन केलेलं नाहीये, परंतु याचे गैरफायदे थोडे जास्त होते. इट कॅन बी अ पर्सनल चॉईस what you do in your own bedroom with your partner with a legal consented thing. It is your own matter. पण सेक्शन 377 मध्ये अननॅचरल सेक्स हे क्रिमिनलाइज केलेलं होतं. त्याचा त्रास अनेक लोकांना व्हायचा. सेम जेंडर ज्यांना जे होमोसेक्शुअल्स आहेत किंवा ज्यांना आपण थर्ड जेंडर किंवा हिजडे म्हणतो, ज्यांना म्हटलं जातं, जे चुकीचे शब्द वापरतो, पण त्यांचा पोलिसांना आणि क्रिमिनल त्रास खूप व्हायचा. त्यामुळे इट इज नॉट दॅट द कोर्ट हॅज अलाउड एव्हरीवन टू डू अननॅचरल सेक्स. It has only decriminalized the unnatural sex, especially anal intercourse है तो decriminalize किया है. तुम्ही बंद दरवाजामध्ये तुमच्या पार्टनर जो समोरचा आहे त्याच्यावर कन्सेंटने तुम्ही काय करताय ऍज फार एज इट इज नॉट हार्मफुल टू बोथ ऑफ यू त्याच्याशी ते क्रिमिनल त्याचं त्या गुन्हा म्हणून काढून टाकलेला आहे. इट इज ओनली बीन डिक्रिमिनलाइज्ड.
It should be consensual and in measure, but it will remain in force in case of minors and non-consensual.
Definitely. Yes. Anything which is unconsented, it will be a rape. Definitely. Unnatural minor असू दे, वेडा असू दे, मतिमंद असू दे, कुठल्याही वयाचा असू दे, पण consent नाही. Definitely it remains there. It is only decriminalization of a consented sex.
So last scenario, school authorities report some students of class 9 have caught watching porn. They want you to address the students about the same. They also want your opinion on whether concerned students should be punished. So what is your take on this matter?
Basically, here comes the education about sex in the school. These people, what they are going to do, the school will punish them, they will go home, we will talk something to the parents will talk, tell the students, tell the sons and everything to go, means to take it seriously and everything. Here comes the education which is to be included in the sex education in the schools. So we have to think seriously about the sex education in the school over here.
Rajeshri ma'am, what do you think of the human interaction will adversely affect adolescent behavior and sexuality?
Of course yes, कारण ह्युमन इंटरॅक्शन याचाच अर्थ आहे की आपल्या सगळ्या ज्या हॅपी हार्मोन सिस्टीम आहे, डोपामिन आहे, सेरोटोनिन आहे, ल्युटिनायझिंग आहे, ऑक्सिटोसिन, हे सगळं त्याच्यामुळे डेव्हलपमेंट होतं. न्यूरॉनल लेवलला प्लास्टिसिटी, इलॅस्टिसिटी, हे सगळं डेव्हलपमेंट होण्यासाठी आपले ह्युमन बिहेवियर हे इम्पॉर्टंट आहे. आणि या इंटरनेटमुळे किंवा सर्फिंगमुळे किंवा ह्या सगळ्या गोष्टीमुळे ते कमी झालेले आहेत. ते व्हर्च्युअल ॲडिक्शन्समुळे रिअल ज्या गोष्टी कमी झाल्या त्याच्यामुळे इमोशनल डिसऑर्डर्स, मेंटल डिसऑर्डर्स, डिप्रेशन, अँझायटीज या गोष्टी वाढलेल्या आहेत. आणि पॉर्नोग्राफी जेव्हा मुलं बघतात तेव्हा त्यांना पॉर्नोग्राफीचे साईड इफेक्ट किंवा डिसएडव्हान्टेजेस काय आहे हे सांगणं महत्त्वाचं आहे. की त्याच्यामध्ये अनरिअलिस्टिक आणि डिस्टॉर्टेड सेक्शुअलिटी दाखवतात आणि त्यामुळे ते फॅन्टसाइज करतात की नॉर्मल किंवा बॉडी इमेज पण पूर्ण वेगळी असते. आणि जेव्हा नॉर्मल सेक्शुअल लाईफ असणार आहे तेव्हा तशी बॉडी इमेजचं पार्टनर तुम्हाला नसणार आहे किंवा तशा पद्धतीचं व्हायलन्सही नसणार आहे. तर हे सगळं त्यांना
गरजेचं आहे. आणि पेरेंट्सला सुद्धा वी हॅव टू बी व्हेरी विजिलंट. दीज आर द वेज हाऊ किड्स ते आपल्याला म्हणजे उल्लू बनवतात थोडक्यात. सो क्लिअरिंग द ब्राउझिंग हिस्ट्री आणि हे सगळं तो आपल्याला टेक्नॉलॉजिकली मला असं वाटतंय सांभाळणं फार गरजेचं आहे.
येस, थँक्यू. आणि एज अप्रोप्रिएट आणि प्लेस अप्रोप्रिएट नॉर्मल बिहेवियर त्यांना फर्मली एम्फसाइज करायला हवं.
सॉरी टू से दॅट, पण पोर्नोग्राफी थांबवणं जवळजवळ अशक्य आहे. बऱ्याच वेळेला असं होतं की मुलं पोर्नोग्राफी सगळ्यात पहिले आपल्या पॅरेंट्सच्या फोनमध्येच किंवा ते उडून बघतात, त्यांना तिथंच वेबसाईटचा ॲड्रेस पडतो आणि तिथून ते पुढं बघत राहतात. जर आपले आमदार खासदार संसदेत बसून पोर्नोग्राफी बघत असतील तर हे इरॅडिकेट करणं अवघड आहे. पण किती प्रयत्न केला, इट इज डिफिकल्ट. पोर्नोग्राफी हॅज बीन देअर सिन्स एजेस. फक्त आता खूप इझिली अवेलेबल ॲट युअर फिंगरटिप्स एवढं झालं. इट्स व्हेरी डिफिकल्ट, दो डिझायरेबल बट व्हेरी डिफिकल्ट टू स्टॉप.
थोडेसे इथे स्ट्रिक्ट आपण गाईडलाईन्स ठेवले होते इथे की रेकमेंडेशन की 14 वर्षाच्या आधी स्मार्टफोन देऊ नका आणि कॉम्प्युटर डिव्हाइसेस रूम मध्ये देऊ नका. म्हणजे दॅट वी कॅन ट्राय अँड इम्प्लिमेंट सम ऑफ द रूल्स. आय एम शुअर आपण सगळेच इम्प्लिमेंट करतो ॲज पेरेंट्स. सो
thank you all the panelists and all the audience for giving this interaction. Thank you.
So I would like to invite Dr. Sunita Mittal Madam, President of the Madam. All the chairpersons, please come on the stage. And all the panelists. I would like to invite Dr. Vivek sir to felicitate all the panelists.
Moving on to our next session, I would like to invite Dr. Ashish for emergencies in team practices. This will be our last session, last lecture of the session. I would like to invite Dr. M.K. Nanda sir, Dr. N. Gujar sir, Dr. Prasad, and Dr. Vinod Shete sir to chair the session.
After this lecture, we'll have a group photo. Second. Traditional wear मध्ये आलेत, so we'll have a group photo. So please don't go and change.
I will request Dr. Vinod Shete sir to introduce Dr. Ashish sir.
It's my pleasure to introduce Dr. Ashish sir. He's a good friend of mine. He has passed his MBBS from Vijay Medical College, Pune in 2009. He has passed his MD Gynecology from All India Institute of Medical Sciences, New Delhi. He has done IF fellowship from 21st at Century Hospital, Gujarat. He is the director of Shiv Chaitanya Distribution Center at Varanasi and Sangoli. He has performed more than 4,000 IF cycles so far. Performed more than 10,000 laparoscopy and external surgeries. So it's good, sir.
Thank you, sir, for kind introduction. I will like to say thank you, IMA Akluj, for giving me opportunity. I know it's getting late, so I will wrap up my talk in within 10 to 15 minutes. And today's my talk is about emergencies in infertility practices. Most of us think that the IVF consultant or those who are doing infertility practice are watching obstetrician doing their night work and they are just watching relaxedly. But it is not like so. Most of the time the infertility expert or IVF expert or those who are doing infertility practice may face some emergency cases. So we will discuss the certain emergency cases. 28-year-old female with primary infertility undergoing IVF cycle with antagonist protocol on injection FSS 300 units. Developed abdominal pain, fullness and difficulty in breathing. On examination she was having tachycardia, hypotension, her saturation was about 95-96. Her abdomen, the abdomen was distended. The transvaginal sonography showed the bilateral ovaries bulky, about 13 into 10 into 13 centimeter. Ascites was there. Her serum E2 levels were more than 3000. The diagnosis is obvious ovarian hyperstimulation syndrome. It's a completely iatrogenic complication which we came across while doing ovulation inductions and ovarian stimulation in infertility, that is ART cycles or in superovulation. The syndrome is characterized by increased ovarian volume leading to increased vascular permeability leading to prothrombotic effect. In most cases, the ovarian hyperstimulation syndrome is self-limiting and requires supportive management. It is seen in about 5 to 8% of IVF cycles. The mild form is most common, about 30% cases we see mild form. Moderate to severe form in 3 to 8%, and life-threatening, that is severe form, is seen in about 1 to 2% of cases. The pathogenesis is obvious. the dose of gonadotropins leading to multiple follicular development, leading to high E2 levels, leading to high HCG levels in the body, leading to release of certain vasoactive factors, leading to capillary leakage, ascites, thromboembotic conditions. So, mild ovarian hyperstimulation syndrome is characterized by mild abdominal distension. The ovarian size is usually less than 8 cm. While moderate, the ovarian size is between 8 to 12 cm. There is clinical and sonographic evidence of ascites associated with moderate abdominal pain, nausea and vomiting. The severe and the critical is rarely seen nowadays because of arising of antagonist protocol in IVF practice, but it is characterized by clinical ascites, oliguria, hemoconcentration, hypovascularity, and the ovarian size is more than 12 cm. While critical ovarian hyperstimulation syndrome is characterized by tense ascites, hydrothorax, HCT is more than 0.55, WBC count is more than 25,000, and there is renal failure, thromboembolism or ARDS also. So, managing ovarian hyperstimulation syndrome, the vigilant cycle monitoring, the use of GnRH antagonist protocol, use of metformin, reducing the doses of HMG or FSH, use of GnRH agonist as trigger, freeze all cycles, use of dopamine agonist, use of aspirin, posting of IVF cycles, use of luteal GnRH antagonist administration. These are the certain primary and secondary measures which help us to keep our IVF clinic ovarian hyperstimulation syndrome free clinic. As we discussed, the most of the cases are mild to moderate, and they can be treated on OPD basis, but at the same time the monitoring of the her WBC count, her periodic sonography, monitoring her urine output is important. So the ovarian hyperstimulation syndrome. Then the next case which we might face, let's see. The 32-year-old female undergoing embryo transfer, she had 2 FET blastocysts. On day 14 post IVF, her beta HCG is about 1800, so everyone is happy, family is happy. She was given luteal support on beta HCG days and was advised to follow after 10 days to confirm pregnancy is viable or not. But due to her some family problems, she missed the OPD visit, and on day 14 of HCG report, she comes to emergency casualty with complaining of pain in abdomen and giddiness. On examination, she was pale, hypotensive, again tachycardia, abdomen was tense, distended. The USG pelvis reveals intrauterine pregnancy about 6 weeks and the right agnexal region about 6 into 5 cm with hemoperitoneum about 300 ml. The diagnosis is heterotropic pregnancy. It is a presence of normal intrauterine pregnancy along with ectopic pregnancy. So we all have to keep in mind the ectopic pregnancy as well as the heterotropic pregnancy while doing infertility practice. We all know the differential diagnosis. The gynecological diagnosis are DDs are spontaneous abortion, the ruptured corpus luteal cyst, abscess, ovarian torsion, PID. And the non-gynecological DDs are acute pyelonephritis, pancreatitis, renal ureteric calculi. So we all know the ectopic pregnancy is implantation of products of conception at a sites other than normal endometrial cavity. The case here we seeing is heterotropic pregnancy. Here the management is laparoscopy and the removal of affected tube. At the same time, continuation of luteal support to maintain intrauterine pregnancy. So I will just skip few slides. And then the emergency case number 3, 36-year-old female, known case of diabetes on insulin, known case of hypertension, come with male partner for IVF because male partner was having severe oligosteroteratozoospermia. On examination, she was obese. Her TVS shows bilateral PCO. On routine examination, the left breast shows 3 into 2 cm hard lump. The FNAC was advised and it was carcinoma breast. We are seeing number of young female with gynecological and non-gynecological cancers, and the CA breast we commonly see during our infertility practice. In such a case, we do her ovum pickup, ICSI, embryo freezing, and embryo transfer after completion of her CA breast treatment. The emergency case number 4A, 4B, 4C are seen in case of male partners. The young couple with tubal fracture undergoing ICSI cycle for tubal fracture planned for ovum pickup, but on Sunday. But on Friday night, husband met with road traffic accident and had femur fracture, and he was unable to give semen on the day of ovum pickup. The second scenario, the couple planning for IVF cycle, husband 2020 cricket player had testicular trauma while playing cricket. And the third case scenario, the couple planning ICSI cycle on day of ovum pickup, husband unable to give sample due to anxiety and need the help of partner for semen collection, but the wife had general anesthesia for ovum pickup. These are such a peculiar emergencies we see in infertility practice. In such a scenario, the counseling and advising couple about sperm freezing before starting IVF cycle help us to avoid such emergencies. This is also applicable for the policemen, army men, and the certain blue-collar workers. So, takeaways of my topic is every ART treatment should be initiated with a plan for emergencies in mind beforehand. Counseling of patients for counter procedure for emergencies should be done before starting IVF cycle. Not only female but male counterparts should be advised for the case scenarios such as 4A, 4B, 4C. Associative treatment for emergencies and assisted facilities should be in prima in IVF infrastructure. Thank you.
Thank you, Ashish sir, for your elaborate discussion about the emergencies in IVF practice or infertility practice. Thank you very much.
Thank you, sir.
I would request Dr. K. Nanda sir to felicitate our class. And I would request Dr. Subhash Pade sir to felicitate all chairpersons. The session is concluded. Request everyone to gather for
I request all the beautiful ladies to please come on stage. Apne photo at this stage. My number is Akluj.